All right, it looks like we are on the air. Excellent.
Yes.
So we've never done a Hangout on air before, so if we screw something up, we apologize in advance. And I just have to apologize already because I'm Canadian and that's what we do.
Yeah, well, I should let people know too that my computer is like 1,000 years old. So if you,
It's going to overheat and
yeah,
possibly
you know,
explode.
I actually put like an extra fan near it. So I don't know if the microphone's picking up the extra hum of that fan, but
It,
just should ensure that it doesn't overheat too much. I tried using my pad before, and I'm too awkward.
I always look at the wrong spot when
Yeah.
I'm recording from the tablet or the phone or whatever. So, I guess May is Asthma Awareness Month. Yay, I guess. I don't know. So we got people to ask questions that we are going to answer on this call, and most of the questions about asthma. Some of them are not about asthma. And um, should we introduce ourselves?
Uh, Everybody knows who we are. No.
Oh, maybe not.
Yeah.
Maybe we'll get internet famous now.
Yeah. Well, you go ahead. Ladies first.
Oh, I don't. I'm so terrible at introductions. You have to go first because I can't do this.
Okay. My name is Steve Godet, and no, I'm not Canadian, but I have a Canadian last name. I'm actually in California. I live in the San Francisco Bay Area, and I have really, really bad asthma. You wouldn't probably know by looking at me, or if you met me for the first time, because I mean, unless you saw my blog or something, you probably would have no clue. But anyway, I'm also, even though I don't actively work anymore, um, I am a registered respiratory therapist and I have a license to practice respiratory care in the state of California. So I know my asthma stuff really well. And Kerri?
And on that note, just remember that nothing we say ever constitutes medical advice, even if Steve is a professional. Yeah, my name's Kerri, as we've probably covered, and I live in Canada, but my name's not that Canadian like Steve. Um, I was in California last week with Steve,
Yep.
and pretty much at this time we were discussing going to the Jelly Belly factory, I think. So this is completely irrelevant to my introduction, but I think it's interesting. Um, I'm just, well, I have finished university. I'm waiting to graduate pretty much. Hopefully I've passed the last two classes, but I will graduate with my Bachelor of Physical and Health Education in June. And um, yeah, I don't know. I spent half my life on the internet, so pretty much whatever else you would like to know about me can be found somewhere online.
Way to go.
I told you I'm bad at introductions. All right, so question one is from my friend Ellie Jella, who asked us, who is your favorite asthmatic athlete, actor, singer, and or politician, and why? So we'll go in order here. Athlete. My favorite asthmatic athlete is Steve.
Like,
Yeah, like you.
oh,
You are
not,
my you
not
you
good.
are my favorite asthmatic athlete.
Oh,
Um, you and well, you know what? I don't even because my other favorite asthmatic athlete is Anton Strålman, and he's like an NHL player from Sweden. But I don't even know what team he's playing for right now, so I don't think even if he's playing in the NHL, so I don't even like I can't even really say that he's my favorite asthmatic athlete because I know pretty much nothing about where he's at right now. I know he went from like Toronto to Calgary. I don't know if he even played any season games for Calgary, and then went to Cleveland, and that's about all I know about him. But
is he out about his asthma? I mean, how did you know that
he
he
like
was?
when I was first diagnosed, I was looking at like this website from the Ontario Lung Association, which is like what is it, teenasthma.ca, and they did an interview with him on the website, and he's quite attractive, so that was also a bonus. Um, yeah, so he would be my favorite athlete. Steve, who's your favorite athlete? Do you have one?
Well, I have lots of favorite athletes, but I don't know if they have, I don't think they have asthma because, and the only sport that I really like is, of course, race walking. Growing up, and it has nothing to do with being asthmatic and all that kind of stuff, but I was kind of a nerdy, especially this would be back in the 60s and stuff. I was kind of a very anti-sports type of kid. I mean, I like the kind of sports that you wouldn't really consider sports. But anyway, later in life, yeah, when I decided to get physical or try to get fit or whatever, race walking is what I picked. And it is an Olympic sport. It's a real sport. It's not a made up thing. And so I have like lots of idols and heroes and in that field, but I don't think any of them have asthma. And like I was telling you before, if they did, they probably wouldn't be the best in the world because in that particular sport you need lots of lung power. There's, I'm sure there's tons of athletes who have exercise-induced asthma, or maybe have an inhaler they use occasionally. But at least the heavy endurance type sports, I don't see how you could do it without a really, really bad asthma. Having said that, I know a lot of runner friends who I've met in marathons and different races that I've done who have varying degrees of asthma, and they're able to run marathons at least a good portion of the course they can run. But getting back to the original question, I really don't know anyone like that's in the spotlight that I follow that has asthma. I mean, it's almost so common
Yeah.
that you should kind of assume that 1 out of 10 of your favorite people is going to have it. So.
So I can't really go for the actor question because I know no cultural references. Do you have any actors that you know of that have asthma?
No, I mean I've probably read about some, but they obviously didn't stick with me because nobody really comes to mind. I mean, again, I'm like you. I don't follow Hollywood or people that do plays and stuff. I don't know.
Yeah.
in that in that area. And same goes for musicians. Even though at one time I did Google to see if there was a disabled musicians group, which there actually is, a foundation for disabled musicians. But within that group, even there, I couldn't really find like asthmatics who were disabled, in that way. So that's a big negative for me.
So in terms of musicians, I was talking to my coworkers, yeah, my boss and a couple of my coworkers yesterday about some of I don't even think we were talking about this hangout specifically, but we were talking about asthma for some reason. And Pink has asthma, and I enjoy Pink, so that's
Oh, really?
yes.
Yeah. See, I don't.
Yeah.
I mean, I know I've heard of these people, but I don't really know.
Yeah, so I know Pink has asthma. Other than that, I think like I don't even know who else has asthma, but I think like she would be obviously my favorite one who I know of that has asthma.
Yeah.
Politician, just because I know the person who answered this question, Stephen Harper, the Prime Minister of Canada, has said that he has asthma, and I would not in by any means call him my favorite politician. So I just wanted to put that out there because I know that she was probably vying for a Canada reference.
Okay.
But yeah, so if you didn't know, Stephen Harper, the Prime Minister of Canada, has asthma.
Oh,
Um, yeah, other than that, I can't say anything about politics. Because I'm sure at this point, like people are like, Stephen Harper's the Prime Minister. What about Rob Ford? And I'm like, no, Rob Ford,
yeah.
no Rob Ford. Um, yeah, oh my God, I don't do politics. It's just like no. Okay. I don't know. Should we? Okay, let's go with I'm trying to make questions flow here. So
Yeah.
we'll go on to the second one on the list. So if there was a cure for asthma tomorrow, how would your life change? Ha,
Um, well, that's pretty obvious. Hopefully for the better.
yeah.
Um,
I can say pretty certainly that I wouldn't have two of these sitting right beside me right now.
yeah, I would, for sure. Yeah, it would definitely change. For one thing, I wouldn't be here. I'd be at work. I'd have, yeah. I don't know if that's a good thing or a bad thing. No, no, of course. I mean, it would totally change. That's
Well,
a cool.
okay, hold on, Steve. If asthma were cured tomorrow, though, you wouldn't be dealing with any asthmatics at work, though.
Yeah, but there's plenty of other obstructive. Well, actually, there's all kinds of other diseases, not necessarily obstructive, but they would still need RTs,
Yeah,
mainly to work in the ICUs and stuff. You bring up a good point because if asthma was cured, logically all the other obstructive diseases would probably follow suit, except the ones that, yeah, and if you caught them in time. I mean, COPD in general would you'd have to kind of wipe that out as well, or at least
yeah,
part of it. And so what you'd be left with is just maybe smoking related diseases or something. Everything kind of overlaps. So
yeah.
no,
I mean, if asthma were cured tomorrow, too, doesn't mean that we would be cured tomorrow, which is kind of unfortunate. But
yeah, uh, just that answer actually reminded me of another question that's on the list, but I wait. These are kind of heavy thoughts. I mean,
I mean, if you want to jump ahead to another one, we can do that.
no, 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 no. That's okay. I like, I like the direction we're going now.
All right.
No, that's the coding of the questions for me. We'll figure out. Does that mean the orange ones are more difficult to answer than the green ones?
No, well, the orange ones, I've color coded the questions on the list, and the orange ones, which is what we're doing now, are philosophy related.
Oh, so you didn't provide me with a key to.
I did. It was in the email.
Yeah, of course, I didn't read it. Right?
It was in the first email because then you switched the account you were reading from.
Oh, I did. Oh,
Yeah, yeah, because you requested I give permission to the other account.
you must have posted it on your drive, not mine. I wouldn't have access because it was on
Well,
your.
I shared the document to you, but then it came with a request to like send it to your other account. It was really
Oh,
bizarre.
because when I tried to open it, it said I had to get your permission to go
Oh,
on your drive. So Google's
oh.
Google's funny. I don't understand that stuff anymore.
Google, if you are listening, we don't understand you.
So
All right. That was a good foray off into space there. Um, okay, so I guess I didn't really answer that question. Other than that there wouldn't be like two inhalers sitting beside me. I don't know. Given that I don't given that I can't talk, given that I don't have like really severe asthma, I don't know how much my life would change like drastically. I think like I would spend a lot of time thinking about other things, but I don't know if I would like think about. I don't know. It's like it's so hard to say. Like you can't. I mean, unless it happens, you can't even begin to think about it, right? So
let me ask you this then: um, if you didn't have asthma, would you still be interested in health advocacy or chronic illness? And I mean, because I most people know that you're probably know. I don't know if everyone knows that you're involved in not just asthma groups, but all sorts of different.
well, and that's I mean that's an interesting question too from my end because I don't think that I would. I think I would be involved to a degree, but I probably wouldn't have learned how to be involved. Like, okay, well, I guess this is going back to like or going on to another question. But had I not been diagnosed with asthma or not gotten asthma or whatever, I think like I wouldn't my life would have taken a completely different path, I think, and I don't think that's for, the I don't think it's a bad thing. Because like I mean basically what if like Steve is, but if you're familiar with kind of my story and my whole journey through this thing, I was diagnosed when I was It's like a month before I turned 17 was when I was like finally actually diagnosed, kind of. And and then like after that I started connecting with people, and then Steve is actually like partially to blame for the rest of the course of my life, because I was like I was reading his blog and watching him like train for races and stuff, and then I finally decided to get off my butt and do something. And so I was 17, and then at that point, you know and then pretty much at that point Steve and I started like clicking, and kind of trying to do asthma advocacy things. And then like 2 years later, I switched my major in university to kinesiology and applied health, and did like a bunch of stuff related to physical activity and health and chronic disease and whatever. And I don't think that shift would have completely happened had I not been diagnosed, right? So
curious.
yeah, it's interesting to think about, because I don't think about it a lot, but I do think that it probably kind of carved a bit more of a path than I would have anticipated, even like, and in a really good way, not in some kind of limiting, crappy situation, right?
Yeah, I got you.
So, okay, so I've answered question 2.5, which is, if you never had asthma, how would your life be different than it is now?
Yeah. Hmm. Okay, and I answered it too, I guess. Sort of.
Sort of. I think for you that would be like a tough one, because you're diagnosed so young, right? Like,
Yeah, I was going to say, in your case, you're like borderline adult onset. You're still considered a child, I guess, but or you would
yeah,
not now, but and also I don't know if you want people to know about you were born earlier than you were supposed to be.
yeah.
You were you were a very tiny baby, um, and so who knows if that was like a setup for your disease later in life, or I don't know. A lot of researchers don't know, well, as you know.
Yeah.
We
Well,
talk,
and a lot of research isn't being done either.
yeah, exactly.
Yeah, like, and that's something I've always wondered too, is that like what because I know there are studies that that you have sent me that say like people who are born premature are more likely to develop asthma before they're 8 years old,
Yeah.
but I was diagnosed like double the time after that, right?
Could,
So
could it be that you actually had symptoms and didn't know it, or I
and,
mean,
and then and then they just got worse, and I finally like realized.
yeah, I mean, because when you say you were diagnosed, I mean,
Yeah,
people it takes years or
yeah, well, exactly. And that's like, like I say all along too, is that I'm about 95% certain that I've had exercise-induced asthma for like my whole life, and not,
yeah.
you know.
But you're also on a lot of medications. Like if you consider yourself a mild asthmatic, you're actually taking more medications than most mild asthmatics take.
Right.
I
Yeah.
think your asthma is not as mild as you think, or it's different. And I mean,
Well,
you
see,
take meds every day. I know because I've been with
yeah.
you.
Yeah. Well, and that's what I'm, curious about in terms of like, future research, is that, just because I have, and I mean, this comes into another question too, is that, because I have, for the most part, normal PFTs, but, I obviously have, significant reaction on the meth challenge. Like,
Right.
so I obviously have asthma, but, is it manifesting differently because of how I started my life, right?
I,
Like,
that's how I would lean if, for lack of anything else that I
yeah,
compare it to. It's and we should also point out that normal PFTs don't mean anything.
yeah,
You get significant asthma and have normal PFTs. It would be abnormal if your PFTs were normal during an attack, of course. In which case, then you wouldn't have asthma. But the fact that your PFTs just happen on a particular day to be in the normal zone or whatever doesn't mean anything. We tend to always point to these hard numbers, when we're talking about severity and all this other stuff. But just so people know out there in case they're curious.
Yeah. I
Don't
think,
be worried.
I mean, I think too is that people take FEV1 as such a big player, and I mean, there are other factors involved, not just that one single number, right? So,
Exactly. And, and actually, the fact that your PFTs do return to normal is a good sign. That means it's a good sign, and it confirms your diagnosis in a way because you reverse. Reversibility is the difference between emphysema, basically, or hardcore COPD and asthma. That's the distinguishing thing. If that's not present, then you can't really say if you're that you're asthmatic. So that's actually a good thing. So
yeah, yeah. Well, I mean, because I would say, like, well, obviously, most people with asthma have completely normal PFTs when they're, not super symptomatic. Like, I can't even say symptom free, but, like,
yeah, yeah, exactly. So which brings us to another question later, but that's further down the list about
I mean, you can swing over there now if it
Oh, no,
makes
no,
sense.
we're getting too clinical now. You need,
Oh, you want to go back to the fun question? You want to talk about politicians again?
no, no, no. I'll skip the whole political thing for now. That'll start me on a tirade about bringing, because the government here. I don't know if you heard this. Canada is trying to make asthma an over-the-counter disease, an over-the-counter. All the meds they want to make over-the-counter, which probably not the smartest thing to do. I
That's
think.
insane.
Yeah, so there are some things going on behind the scenes. Real advocates that are in Washington right now. So,
I don't
yeah,
know. I don't think because they're in Washington they're any more real than we are. They're just into policy, and I'm not.
yeah,
I'm not
exactly.
into policy.
And they actually need people like us to put a face on. I mean, because the people represented, most people that represent us don't have the disease, obviously,
Yeah.
which might be actually a good thing. So they can distance themselves a little bit. So so we're unique.
Yeah.
I don't know.
I mean, it's like talking about, like sports and sports and like, famous people and whatever. I think it's kind of a paradox too because we work to get people to understand that asthma is serious and needs to be addressed and shouldn't be an over-the-counter disease, and but at the same time we're also trying really hard to prove that we can do whatever we want to, and um, I don't know if you I don't know if we can adequately make the point that you know we are completely deserving of better treatments and research and whatever, but we also, refuse to, well, a lot of us refuse to kind of limit ourselves because of our disease, right? And
Yeah.
it,
It'd
you
be,
know, it's a
it'd be
paradox.
interesting to find out what it would be interesting to find out what percentage of people feel. I mean, of asthmatics feel that way. That they do feel like they can deal with their disease. I mean, that they don't let their disease slow them down and stuff. I
Yeah,
mean, we take it for granted because we that's how we are. I mean, that's as individuals that's how we're. But a lot of other asthmatic friends of mine don't, for one reason or another, don't see themselves that way. So it'd be interesting to see just how many people feel the way we do about
yeah. So
that.
I think this thing should be actually posting onto my YouTube channel after we're done. So if people want
Oh,
to carry on the discussion below, that would be excellent, and just see if you kind of share some of the same thoughts with us, or have different ones that you'd like to share.
where were we? Oh, question. Are we on 2 5? Oh, question 3. Are we going in order still? Or,
It doesn't matter.
oh,
Um, I think yeah, we can go on to three, or yeah, let's go. We'll go on to three. So this one is how I can't talk. How have your thoughts, perceptions, understanding of asthma changed over time?
you or me for.
Doesn't matter.
Um, That's another tough one. I mean, I've had the disease since day one, and probably wasn't really aware of it until I was 6 or 7 years old. Then I knew something was wrong or that I wasn't normal. And also, I grew up in a time, again, during the 50s, 60s, and 70s, where asthma was totally different. The way the public, the way the medical field, the way they viewed asthma was totally 180 degrees different than it is today. And so I think it pushed a lot of people like me in the closet, in the asthma closet. You didn't talk about the disease. I think it was embarrassing, even like for family or people who knew asthmatic. It was considered a nuisance disease, a disease that could be partially in your head. Psychosomatic was a term that they used a lot back then. So I really didn't even consider myself having a problem, even though I was always sick. I didn't, you know how kids are. You work around and you like dwell on it. And it wasn't until actually I was in my mid 20s that it dawned on me that I have this horrible thing that it's making it really hard for me. That makes me suffer a lot and this and that. And anyway, skipping through all that up to present day. Um, my thought now is that we're in a time period that we're just starting now to look at asthma as a disease. I mean, it's been around for a long time, obviously, but it's only been within the last decade or two that we're actually taking a closer look at the disease. I mean, and I'm not just saying this because I'm involved, because I work in the medical field, because I'm involved in research, but so if anything, what I've learned is that we know nothing. we're we're just now getting the grasp that we can actually say we know something about asthma. I mean, the research is at its infancy. It may not seem like it to younger people, but it actually is. I mean, up until a decade or two ago, nothing was happening. There was one or two drugs, and that was it. And now we're starting to dig deeper. And so to me, in a way, it's kind of exciting. And I know in my lifetime we won't have a cure, or probably not even better treatments, but I think maybe in your generation and people that are younger than you will see the benefit.
Yeah.
It will be a totally different disease, the way we treat it, the way we look at it, and everything else. So that's kind of a broad answer, but so yeah, I look at it as a bit of a challenge, and I don't. And having medical background, of course, I look at it from a science view as well, but I can't like not do that. So
Yeah.
now
Well, I
I'm
think you've
really interested in your thoughts since you've only dealt with it for 6 years,
yeah.
or you were diagnosed in 6 years ago.
Yeah.
You've probably been dealing with it longer and you just don't know it. But
Yeah. No, I think it's interesting too because like you have both sides of it, but you also have seen more of the history unfold, right? Which is
yeah,
um probably why we'll have, kind of divergent views on things. But I think like for me it's more been on like, a personal level that, my thoughts about asthma have changed. I'm not really sure how to best like summarize it because it seemed to me it was such like a natural progression, like like I already talked about, in terms of like my diagnosis and kind of towards the end of high school, and then starting to do more physical activity, and then switching my major in university to something related to physical activity. And um so I think like I obviously learned that people with asthma have, like I I can't even say less limitation than I previously thought, because I don't think I ever perceived that asthma was a limitation. And I think that's even more true of young kids now, like who are born, after the year 2000 or whatever. They're not, those kids aren't even young anymore. But I mean, kids who are like, 7, 8, 9 years old now, I don't think that most of them really perceive asthma to be any sort of, barrier. I could be completely wrong. I'm not 7 years old, but from my experience with the kids that I work with, and just kind of like that, they're things like asthma and food allergies and stuff. They're aware of it, but they're aware of it in a way that I think they're able to make it very normal for kids who like for their peers who have the disease, right? So um, they just like they're just like, yeah, well, so and so, can come play with us in a few minutes. She has to take her puffers or whatever. Like, it's very normal to them, and I think that's really good. Um, and I think their kind of approach to it has probably changed some of my thoughts too. And because like especially too when my kids at work find out that I have asthma, they get like the kids who have asthma, they get really excited. And they're like, oh, you and so like so and so also has asthma, and they get like excited, and they want to learn more, which is I think probably very different from the older generation, right, where they just don't want to learn.
Yeah. Sometimes I wish I was born in, well, no, I can't say that. 30 or 40 years later on. But what do you think the public's perception is in general about asthma? In your generation, I mean, your age.
I think, well, I don't know, and I don't know if it's my generation or just my age in general, because I think, like, people with asthma who are my age are mostly just fairly apathetic about it, and, whether that's because they have, really mild disease and, they, like, they use their Ventolin, like, once a year or something, or, you know, don't have it at all. um, or, because I haven't met anyone like anyone in my area who's my age who has the same, understanding or same desire to kind of change how people see asthma as I do. And even the people that I've met online who are my age, I don't think they're not interested in becoming advocates and to the same degree, that I am, or I mean, they're not interested at all, right? They come and they ask me a question or two, and then they, go off and live their life again, which is fine. But I think if people really want to see the whole, the asthma world, for lack of a better term, change, I think it's important for people like you and I to be getting our stories out there, right? And
Yeah.
putting a face to it. But um, yeah, I don't know if my generation has, a like kind of a solid understanding of the disease, even not let alone like kind of an acceptance towards it.
That's interesting. Yeah. Okay.
Yeah,
Now we're in the blue question.
we are in the blue questions. We have gone on to science. But yeah, blue is science for those of you following along with our color coding system.
Yeah.
Um, okay, so I feel like I'm just going to defer most of these to Steve because
Yep.
Steve is smart at things.
No.
Yeah, sure. Hello, who's the one who was sitting here with like who's the respiratory therapist on this call? You. You are smart at things.
Well, certain things. um, so the question is, let me see if I got this right. Why do some addicts, why do some asthmatics have lots of mucus? Hmm, I don't know. No, I think all asthmatics have a problem with mucus, and I use myself as an example because I don't. I mean, there's a difference between producing mucus and actually coughing, hacking it up, and being congested by it. I, I'm one of those asthmatics that rarely ever produces sputum, but that's sputum. That's the respiratory term for phlegm or whatever, for hacking something up for mucus. But my lungs make a lot of mucus. It's just that it makes it in tinier quantities, but much thicker. So what happens is the mucus, even though I don't I don't sound junky when I cough and I can't produce anything. I actually do make a lot of mucus. It's just that it's further down in the airways and it's in smaller amounts and it's more tenacious, it's thicker, it plugs my airways up. So symptoms manifest differently than someone who has more of a bronchitis component. You have to remember asthma falls under that umbrella of obstructive lung diseases, and bronchitis, whether it's chronic or acute, is in there as well. So, the itis part of the word just means that your bronchioles are inflamed or you have an infection going on. So, without getting too technical or medical on you, your goblet cells produce too much mucus for some reason, whatever the irritant is. Mast cells have something to do with that as well. But so getting back to the question, why do some have lots? I would imagine they have a propensity to have a bronchitis type infection that's triggering their asthma. It's so hard to tell. I mean,
well, and I guess it depends on context of the question too, right?
yeah,
Because I mean, if you have, some kind of other infection plus asthma, then obviously, like,
exactly.
it changes the whole
Yeah,
scenario.
because when asthmatics get sick, it's usually triggered by an infection or something. And so if you're producing a lot of phlegm and you don't normally do that, then obviously you picked up a bug, a virus, or something's making you produce a lot of phlegm. So again, there's a lot of diseases that piggyback on top of asthma all the time. So but you usually see those in the clinical situation when a person is really sick. Um, if you were to tell me that your main problem with asthma is not wheezing, is not being real short of breath, but your main problem is phlegm, then I'd say, well, are you sure you really have asthma, or is there something else going on? I mean, just to cut to the chase, on autopsy, not to get gross people out, but that's what actually kills asthmatics a lot of times. People,
Autopsy?
yeah, when they take the lungs out, when they examine the lungs after someone's died of asthma, if the attack wasn't caused by an acute like anaphylactic reaction to something where the lung system close up, if it's caused by like just this horrible infection that started this event off and you end up on a ventilator, blah blah blah, and you die from the attack, usually what they find is mucus plugs. That's what actually kills you. That's what suffocates you. So I would say that all asthmatics have mucus, only it's more obvious in some, and there's probably another problem going on as well. So there's probably more than you want to hear. And talking about the consistency and the color and the texture, and actually there's a smell component. Ask any of our
Favorite job.
yeah,
Favorite job.
we're like experts at describing mucus and phlegm. I just lost my question. Oh, I'll get it back. Anyway, so your response? Or
Um,
your answer to that?
what Steve said. That's my answer.
I can find my list now. I totally lost the list again. Oh well.
Oh,
Except
so
me, I don't have to tell me what the questions are.
the next one up is why is severe asthma so tricky to diagnose? So we covered part of this because the second part is about PFTs. So Steve? What's your opinion on this? Is if you would you say that everyone with severe asthma has like changes in their PFTs at baseline?
Uh, yeah, that's a tricky one too. Personally, I would say yes, but I know a lot of people are going to say no. I
Because
feel like
I would agree with that, but maybe that's just because I'm
yeah.
biased from hanging out with you. So
I'm not sure you would see it in FEV1. You might see it in the other numbers that reflect the smaller airways. But it would also depend on how long the person had the disease. Obviously, the longer, if it's really chronic disease, and just the definition of chronic, by the way, usually means more than 20 years, depending on who you're talking to. So basically, your whole lifetime, um, you'd have to wait your whole lifetime to be considered chronic in your disease. So, but yeah, I think there would definitely be little hints that you would see in the PFTs, and it might not be the FEV1. I don't think you would have absolutely perfect PFTs. Something would be off kilter a little bit as far as the PFT goes. So
Yeah. Um, yeah, so I think, I mean, the question was just related to why is severe asthma so hard to diagnose, but
yeah,
I think asthma in general, like especially what we were just discussing about, the whole umbrella situation. I kind of like to refer to asthma as like a spectrum because it's not one disease, right? It's a bunch of different shenanigans happening, and then your lungs get screwed up. Um, but I mean, I think like just because of the whole umbrella component, that's why it's so hard to diagnose because I mean, just in general, and that's why I think there's a lot of misdiagnosis and you know whatever because people can have what their doctor has called asthma and really have something totally different.
so what people need to know, and you know this already, is that a huge percentage, and I think it's up to 30% or 40% of people that have been quote unquote diagnosed with asthma don't actually have. They were misdiagnosed. So automatically things are messed up from the beginning because we need a clear picture who actually has asthma. Forget how severe it is. Just at least start and get the basics down, the foundation, before we get off on treatment and phenotypes and all this other thing. We have to establish first that you are actually suffering from asthma because there are a lot of mimic diseases. And
Yeah.
wheezing, you've heard that a million times before. It's not all wheezing is not created equal, and blah blah blah. And it's so true. And I think, and I've always known this. And it took Sally, of course, my pulmonologist, when I saw her on TV talking about the same subject about the misdiagnosis of asthma. I thought, well, I knew that all along. And it was now in 2013 or 14 we're talking about. So that's why severe asthma is so hard to diagnose. It would be a lot easier if you could first establish whether the person has asthma. And actually, the European people just came up with a new, which we're going to latch onto this year probably, to define the terms of severe asthma, the criteria required to label someone basically as severe asthma. So, which is basically just a person who has to take steroids in some form, plus a second controller medicine. That's basically the whole change. So, but the other thing about diagnosing severe asthma, I'll just say, is that we don't have enough pulmonologists that are trained in the field of severe asthma. I mean, we have tons of lung specialists, but the ones who are passionate and study asthmatics, there's not enough of them. They're not available to the people that need them.
Yeah.
So you need specialists. You really do need a specialist to tell you what type of asthma you have, if they know, and how severe it is. Unless your primary care doctor is really up on things.
Yeah.
Another problem.
Yeah. I think too, I think that using, modern technology, even in trying to confirm, milder asthma cases, I think I think that's heavily underused and, um, because it took me several years after I was diagnosed to tell my doctors that I was just I want to make sure we're treating the right thing just because it was so, ridiculous trying to get my asthma in some degree of control. And so I was just can you send me for a methacholine challenge? Can we do something to make sure we're doing, we're treating the right thing? And I mean, I think in general, patients don't know patients don't know what technology like that is available. I mean, it's nothing fancy. It's, you breathe in some crap and you do PFTs for a while, but, I think patients don't know what is available and what they potentially have access to make sure you're treating the right disease. And because I'm pretty sure if I hadn't asked to be do you think it's a good idea if we, try this and see and
I like how you think it's a good idea. I like how that's,
yeah,
that's how you approach a doctor without intimidating them, basically.
yeah. Well, I mean, because you don't want to go in with a massive list of demands, right? But if you make them feel like it was their idea,
Yeah.
then
It's a good technique. I use that all the time.
Yeah, so I mean, I initiated the discussion, but then it was kind of like they were just like, yeah, that makes sense, let's do that. So I've had a lot of, well, not a lot, but I've had, uh, enough testing to know that I have asthma, and I don't know why, because the technology is available, and I mean, feel kind of crappy the rest of the day, but it's like, why would you not make sure you're treating the right things?
Because even if you're diagnosed with asthma, then what? I mean,
Yeah,
there are days when you're obviously having a bad time, and other days when you feel just mildly crappy, what I call naggy, flaring.
yeah,
And ask a doctor about that. I mean, ask your typical, even a pulmonologist, they're going to shrug their shoulders and, oh, what can I tell you? I mean, it's part of the disease. Well, I want to know more. Why am I
yeah,
shrugging all the time? I don't get this. So back to the original point is that, like you said, you need to ask the right questions and you need to have the right doctor. I mean, at least someone who cares about the disease. I mean,
yeah,
in my experience, that so many people, especially older physicians or people that are set in their ways, it's a bread and butter disease for them. You take your inhaler, you have asthma, you do this, big deal. They don't think beyond that. You know,
yeah.
hopefully nowadays more people.
Well, and that was like, I mean, when I was diagnosed, they gave me 2 rounds of antibiotics for bronchitis, and I went in, and I didn't have a family doctor at the time, and so I was doing those all in the walk-in clinics, and it was like, I mean, brutal. Um, but so I had 2 rounds of antibiotics, and I went in, and like I'd seen the same doctor for the second round of antibiotics, and he was just like. And I was just like, this isn't bronchitis, because this has been going on for like 2.5 months. This is, like, I've been on 2 rounds of antibiotics. This is not doing anything. And then he basically handed me a prescription for Ventolin, and he was just like, take this, you'll be fine. And I was just like, okay. And so went on the next 6 months of my life with,
What
but
are the bits and pieces of that? Of you trying to get things worked out. Is it better now? I mean, yeah.
yeah, well, I have a family doctor now, of course. And then, but I mean, I've seen an allergist, and my allergist, even though I don't really have allergies, she was pretty much the key player in figuring out how to better treat my asthma. And she's also the one who referred me for the meth challenge too. Um, she was awesome. I left an appointment one day, and she didn't tell me when to schedule a follow up, so I never did. But my first respirologist, which is the Canadian term for a pulmonologist, he because I don't have bad PFTs, I think he just wasn't interested in me. So he didn't really do like anything. I
Yeah.
think he I think he referred me to the allergist, but other than that, I don't think he did that much. My current asthma doctor is amazing. She's totally awesome. Um, and and she's very good at like she did. Every time I go in, she does the PFTs on me. We talk about medications. Like she does the whole like thorough thing, but she's also very like very personable, which is really nice.
Yeah.
Like my first appointment, she called their super old spirometer old school. So I mean, we're we're on a good note starting there. But I think you have to push, and you have to ask the right questions. And I requested the initial referral to my first respirologist, and then when things weren't working, I actually didn't ask for the referral to my current one because things weren't working out with him. It was because she was doing the study that Steve had linked me to, the study that is now like no longer in existence, which was for the Canadian Severe Asthma Network.
Mhm.
And I had contacted their primary investigator in Edmonton, and she hooked me up with my current doctor. And then so my family doctor made the referral to her. But that the study didn't end up like doing anything, but at least I got a like excellent doctor out of the deal. So,
Good.
but I mean, it's about pushing, right? So,
Yeah, and half the battle is finding a good doctor, or I shouldn't say a good doctor. I mean, there's a lot of good doctors, but finding one that you click with, that
yeah,
you're comfortable with, that you know that works for you.
yeah, and I think like I mean, I think time is obviously crucial to physicians, but
Yeah.
I think someone who takes even a minute to kind of consider how your disease affects like the rest of your life. You know, it's rare, but when
That's
you
a
find
good,
someone,
yeah.
like don't let them go because
Yeah, that's a good point. That's very. I don't think anyone's actually brought up. I think I had a primary care doc, or actually a family doctor like you, that because they're more tuned into that.
yeah,
Okay.
yeah, because I know like and my respirologist, we don't have like she doesn't walk in and know exactly who I am, of course. Like she's smart enough to read the chart before she comes in, so that's that's a start. But like she takes like decent, relevant notes, I think, because she would like my last appointment with her. She actually followed it up on like all of the gynecology stuff that I was dealing with, and she actually bothered to follow up on that, even though it wasn't fully relevant to her portion in my care.
All
Which I mean, I was super impressed. Like, um, so she also went to Harvard, so I mean,
right. Yeah.
but yeah, I mean, I think asking the right questions and kind of going in with a plan. Like, don't just go in and trust them to take care of you. You have to push for yourself, I think.
Absolutely.
And I was going to say, I'm sure you'd agree with that one.
Yeah. Well, yeah, that's a long story, but we'll skip next.
Next, did you lose your like document again?
I have no, and I'm too paranoid to like try to find it.
It says you're viewing it though. It says you're here.
Maybe it's hidden on a page. I probably have a window open that I don't see. No, I didn't see it if it's here. I was
Okay.
muted, and I clicked it off somehow.
Oh, okay. That's fine. So next up we have once again this is a question for you because I'm not gonna be able to answer this. Oh,
Mm.
actually maybe I could. It is. Can you have minimal scarring of your lungs and it not show up on X-rays? Would any type of like
What
tissue
kind
damage show up
of-
on X-ray?
No, you'd have to be so scarred. You'd have to have a pulmonary fire, but you'd have to have such thickening scar tissue in your lungs, otherwise it wouldn't show up at all. I mean, there are other telltale signs on a chest X-ray for asthma, but as far as scarring goes, you have to be extremely ill and have something else going on for it to actually show up on X-ray. I mean, I'm not sure if you'd see it on CT. I think possibly you have to ask Sally or Dr. Wenzel, since that's what she does early, and she does.
We need to do this again and get her in on it. And
Just so you know that what they usually check on an X-ray, anytime an asthmatic goes into the ER, right? If if they're sick enough to warrant a chest X-ray, what they're really interested in is make sure you don't have a pneumonia. Pneumonias show up on X-ray. A good radiologist would be able to tell you. And also they look for atelectasis, which is little air sacs closing off, which is also common in asthma, or if you have pneumonia or something. And the last thing they look at, I mean, there's other things, but these are the three biggies, is they look to see if your lungs are hyperinflated. And that's actually really easy to tell on an X-ray because it's the more air you have in your lungs, the darker the image is on the X-ray. So it'll look like a big hollow balloon. So if your lungs have junk in them from pneumonia, then that shows up more white on the X-ray. So, but no, I never heard of where they could see scarring on a regular X-ray.
why don't you go for a chest X-ray and test the theory?
I've had too many. In fact, I'm to the point now where I almost turn them down if I can because
Oh yeah.
if you think about it, I'm in the hospital a lot, so that means a CT or a chest X-ray. And
Ugh.
even though they say it's safe, I mean, who knows? I've probably had 500 of them in my life. I
Oh
don't know.
yeah. I know, like, I mean, I think I've had one chest X-ray in my life, but
Yeah,
maybe two. I don't know. But I had like, I had a lot of I've had a lot of X-rays done on like my arms and legs and stuff, and yeah, especially too when I was younger, right? So they're super concerned about like stuff happening, but
right.
yeah, no, wouldn't do it unnecessarily.
Yeah, and the chances of you having scarring to begin with are pretty slim, unless you're older like I am, if you've had the disease, or let's say if you've been like on massive doses of steroids for a million years. Yeah, even if your asthma is relatively not mild, but it wouldn't be if you're on steroids. But if it was controlled,
Mhm.
yeah, I mean, steroids could probably do some damage themselves, just being on the drug.
Well, yeah. So would you um so would all incidences of airway scarring show up on like within PFTs to some degree?
They're like the signature of it would like there'd be evidence,
Mhm.
but not really. I mean, because spirometry is just flow rates. That's
Right.
what spirometry means. You're just measuring flow rates, and so you're measuring how fast the air is coming out of different portions of your lungs. So if, I guess you could, not directly you couldn't. It would be a far stretch actually.
Okay, so like
All you would
I
know is
guess so I guess no what sorry, I think my question is more if you have um what like can you have airway scarring and normal PFTs?
probably no.
Okay.
Because
That was my guess.
no, I don't think so because scarring makes your lungs stiff. And if your airways, it depends where in the lung you have scarring, but if your airways are obviously scars are going to be stiff. If they're stiff, then your flow rates are going to be different because they're not compliant. They don't stretch. They don't do what they're supposed to do. So your flow rates would look totally different. Yeah.
Right.
So it'd be so given everything else, if you know the patient's an asthmatic and you see these horrible PFTs or whatever, you can't automatically assume that they have scarring because
Yeah.
other things could cause the obstruction. So,
Right. Yeah,
uh,
exactly. All right. Oh, here you go, Steve. What is it like? It says what is it like being ventilated? Ventilated. So or vented? What is
uh,
it like to be on a ventilator?
to be intubated.
Yeah, I've
Yeah, that's another sore subject. As you
I was
know,
I was this big, so I can't remember.
yeah, I've been intubated 20 times, and people don't know, which we think we joke about this, Dr. Winslow all the time. That could be a world record for an asthmatic. Not one that I'm proud of, but um,
Should go get
it's
in Guinness.
let me let me just say that it's no big deal as long as you're asleep or unconscious. But being awake with a tube shoved down your throat and this machine pushing air into you is is not really fun. And the worst part for me is not being able to talk or well, just all the other weird things that come with it. But usually you're so sick when it happens that you don't really think of it, and you don't actually know. I mean, the tube's just an extension of your own airway. I mean, the endotracheal tube that you put in, it's a plastic hose, is what it is. So it just feels like part of your airway. The hard, if you're awake on a ventilator or even just with the tube in, it's really hard to cough stuff because you have to cough it through an even narrower, you
Ugh.
know, yeah. So yeah, it's not comfortable, but it's not horrible. It's not like this painful thing. It's only painful after they take it out because you usually have horrendous sore throat because endotracheal tube goes through your vocal cords, and so vocal cords look like a V when you look down in someone's throat.
Yeah.
And esophagus, which goes to your stomach, right? Those two pipes, or whatever we call them, are next to each other. So when you intubate, when the anesthesiologist or the doctor puts in an artificial airway into you, they have to make sure they don't put it in the wrong tube. And the way they can tell that they're putting it not in your stomach But the way they can tell they're putting it in your lungs is by visualizing the vocal cords. And that's why they use the scope. And once they see the cords, they put that tube right, you can't see because I don't know where my camera is. They put the intertracheal tube right through the vocal cords, and that's how they know that they're going in your lung and not your stomach. Because I can't tell you how many times they, working in the field, that either I've done it or other people have intubated someone's stomach, and you know right away because they'll start creeping right through it. And obviously not a good thing to try to ventilate someone's stomach. So,
Not too helpful.
so I would say that you don't ever want to be intubated if you can help it. It's not a good sign, and the worst part is that it's dangerous, basically. It's a pathway, open door for germs. Because everything from that point on is artificial, it's been handled by humans. You know what I mean?
Yeah.
We're talking from the connection of the tube to the machine, and everything.
Yeah.
It's a pathway, and plus the environment you're in is just got a lot of germs floating around. So, yeah, hopefully you don't want to be intubated.
Yeah. I know. I didn't explain myself well because I didn't. I never think about the fact that I'm not just talking to Steve. That I'm thinking, possibly talking to people on the internet. No, what I was saying though is about what, because I was born premature, like Steve had said, and I was on a ventilator, but obviously don't remember it.
Well, I mean, you were not even. I mean, you were
Like,
early, so
yeah,
you
like
were yeah.
days old. So yeah, I mean, so
You were a very small baby. I don't know if you people know that, but
yeah, no, it's all on the internet somewhere.
oh, okay. Anyway, she was a very tiny baby, very tiny. We're talking like, well, you're going kilos, but you're around the kilo mark, or maybe under.
We still do pounds here.
Oh, I'm sorry.
Yeah, I know, and it's so funny because like we do everything in pounds, and Steve always tries to convert it for me, and I'm like, I don't know what you're talking about.
That's you do weight in pounds, but everything else is in kilos.
Yeah, we do weight and height in imperial, and everything else in metric.
Yeah, so
We're confusing.
but interestingly, in the medical field, we do everything the other way. So we do everything your way. So,
Yeah,
especially premature babies.
yeah,
We're,
yeah. Because I mean, I obviously had like my weight in grams documented somewhere.
yeah. But anyway, she was a really, really tiny preemie. So,
Steve,
and
Steve knows more about me than I do because he understands my pile of medical documents that I got.
not only that, but when there is an age difference, believe it or not. No, I don't know my age, but I was actually working in the field when she was a baby. So, and I actually worked in an NICU, a neonatal intensive care unit. So, I'm used to working with little tiny what we call neonates, and intubating them, putting tubes, put them on, and managing the ventilators and all that. So it was a good conversation when
Yeah,
what to talk about when you told me she was a preemie, because automatically you're put on a ventilator when you're that small because you
yeah.
don't that.
Yeah, it was interesting actually. Considering I was just talking about my meth challenge, was the RT who did my meth challenge. Because I was asking him 400 questions because I just wanted to make his day a little bit brighter. But he was actually working in the NICU that I was in when I was there. So it was kind of weird going like full circle because it was very likely that he probably cared for me when I was, like this big, right? Like,
They probably had your picture plastic on the wall because they usually do that in the nurseries, especially if they're babies that have been there for months on end or whatever. So, and another thing with you is that you were so small that you had surfactant replacement, obviously.
yeah,
I mean, I saw it in your records because for people who don't know what I'm talking about, surfactant, babies that are born prematurely, they haven't had enough time they haven't developed enough where their body makes surfactant, which is this material that keeps your airways from collapsing, it keeps your lungs open actually, And so, because the babies are too young, preemies like you were, we actually have to put, well, either fake surfactant, which they have, or they get it from cows and from other living beings. And we call that surfactant replacement. And we do that so that your lungs will stay open. And so you don't have a bunch of other problems, which you probably did anyway. But I mean, that's one of the things that probably kept you alive at such a small.
Yeah.
You were how many weeks? 30, 20? I forget now. But you were pretty 28. You were in the 20s, I think.
Yeah.
And that's
Yeah,
kind
because
of,
I was 10 weeks early. I don't know what that translates to.
yeah,
I don't do math.
that's right around the 30 mark. Could be a little bit or a little, but still, 30 weekers are tiny.
Yeah.
And you're just 10 weeks is 2.5 months early. That's pretty early.
Yeah.
Anyways,
All right. To roll forward here. Okay. So this question, I think, like, probably needs a little bit of background, but basically, it is how, I guess, how would bronchodilators affect oxygen saturation?
you could probably figure that one out.
Yeah.
You know already. But we've talked about this subject so many
Oh,
times.
I know, so many times. Because I mean, I guess, like, first of all, it comes down to the whole factor of, can you have, like, bad asthma symptoms and still have, like, normal oxygen levels, blah blah blah. And obviously, the answer is yes.
But why? That's the question.
Why?
But
Why?
why are
You,
they?
you, you want to do physiology time? Because
Just a little bit. So not to bore everyone, but since we're on this topic of oxygenation and asthmatics, which is really what we're talking about,
yeah,
this is it's probably the question I get asked the most often, at least on my blog, and it always pops up in support groups and different asthma forums about the whole asthma oxygen thing. And then one of the reasons it comes up is because um, when asthmatics go to the ER, or when people in general go to the ER because they're having breathing problems, the first thing they do is they put that little probe on your finger.
that's the first thing they do, regardless of why you go in.
Yeah, that's true. It's part of the whole TPR thing where they do temperature, blood pressure, and all that.
Yeah.
It's part of the whole vital signs thing now. And but in asthma, especially, they not only they check it, but they leave it on your finger. And so what happens is, and it's just by human nature, I think, is that the nurses and the doctors take a look and they say, oh, your saturation is completely normal. It's like 99, 100, 98, or whatever. And so the assumption, without even looking at you and assessing you, is this your asthma attack is mild, or you're not having one, or something else is going on. I can tell you as an RT by profession that I'm guilty of the same thing, believe it or not. Having really bad asthma, I see a patient in the ER, the first thing I do is look at their SATs. And it's not because I'm trying to see if they're an asthmatic, but I want to assess how sick they are, basically. Because, anyway, what people should do is kind of disassociate the whole pulse ox thing with asthma. You should really do that. And not worry about your oxygenation, your saturation, unless it's really low. And then I would be concerned, but this whole, to equate the two, it's two separate things. Um, so the quick answer to that is the reason that you can have an asthma flare and have a normal SAT is because asthma is a disease of the what? The airways, not of the alveoli. That's the big thing. That's the clincher. Disease of the alveoli. Those are the little air sacs. When your airways terminate to the very end, there's little great.
They're like tiny balloons.
Yeah, and there's millions and millions of them in your lungs, and that's where gas exchange takes place. That's where your body expels the bad stuff, carbon dioxide, and where it sucks in the good stuff, right? So your bloodstream. Diseases that screw that system up are emphysema and other stuff, but asthma is not one of them. Um, it's true that if your airways clamp up enough, then no air can get to the alveoli. But believe it or not, you can be almost like 99% occluded, because we're talking about gases here, really lightweight stuff. They can permeate. So you're getting enough oxygenation where it doesn't affect your sat that much.
Mm-hmm.
Now, if your sat is starting to drop during an asthma attack, that's not a good sign at all. Because then you hit this weird threshold where now your body can't keep up, basically. And you're getting to the point where you're getting really sick. So that's kind of the why you can have a normal sat and still have a hard time breathing. And the question really should be or the thing that you should really assess is your work of breathing. If you're working like a dog to get a breath in, nothing against dogs, but if you're working really hard to get a breath in, yeah, that's what we should be worried about, not what you're. And then secondarily, then you can glance at your sats. And if you need a little oxygen, give you a little oxygen. But
Yeah.
to dispel this whole thing.
I mean, not to mention too that if if you're basing anything on one reading, like it doesn't mean anything if anything's based on one reading, right? Like,
yeah, exactly.
Your fingers could be cold, and they're like, oh look, like, you know.
Yeah, because a lot of things can cause the set to be normal. If it's extreme, like it's 100%, hyperventilation starts
Yeah.
up. But this is where it gets confusing, because when you have a bad asthma attack, you actually are hyperventilating. You're tachypnic, which is you're not taking really deep breaths, but you're taking fast little tiny ones.
Mm-hmm.
So you're not really hyperventilating, but you're breathing really fast. And so at the onset of an asthma attack, your sats actually go up. It's actually the normal thing because you're moving more air. Only at the beginning, and then you hit that fuzzy line, and then it starts going the other way. So
yeah.
Again, you're absolutely right that you have to use more than this one tool to assess the severity of attack. Because if you wait for the oxygen level to drop, you're in big trouble, usually.
So how would it translate to just like the next part of the question is kind of related to like bronchodilators and low oxygen saturation? Is that related to more like COPD, or how's that?
Understand, like, what do you mean by the neb per? I
Yeah.
Connection between the two. Say it
Well,
again?
see, and maybe that's just it. Maybe like, is there a connection basically? Like, would would bronchodilators directly? Well, I mean, I guess obviously
Oh,
the answer is
would they
yes.
improve your sats if they were low?
Yeah. Yeah.
Maybe, maybe, but again, it all depends. I mean, if the cause of the hypoxia, which is lack of oxygen loss, if if the reason for that is because you're tight, and then you give someone a bronchodilator, they're not tight anymore.
Yeah.
Air moves freely into your lungs, you oxygenate better. So, but usually the response isn't that quick. I've never seen an asthmatic, uh, especially during the acute phase of their sats shooting up after a treatment. It doesn't happen that way. It might be a couple points better, maybe a half hour down the road.
Yeah.
But this instant response, there's like no correlation that I can see.
Yeah. That was kind of my thought too, but
I think it boils down to this. Shortness of breath has nothing to do with oxygen level. And it's a hard concept to grasp.
bingo.
The two are totally different. Shortness of breath is the experience of not being able to get a breath in, the difficulty of breathing, right? It's a unique area. We experience it differently. It's our perspective on the whole thing. Oxygenation is a totally different thing. That has to do with, for some reason, the body's not getting oxygen.
Yeah.
And whether that's being caused by the asthma, who knows? If it is, then it takes a while for that whole thing to set up. So it's not going to be instant.
Yeah.
Like, you can hold your breath, right? You can put a pulse oximeter on you, hold your breath. If you're able to hold it that long, you may be able to get your sat to drop. And what you'll notice is that it'll stay at 100% or whatever until you're turning blue. Let's say you have really good lungs and you can hold your breath a long time. If you can hold your breath for like 30 seconds or a minute, the sat will just stay up there, and all of a sudden it'll start dropping, and then it'll drop faster and faster. It'll just like plummet. Part of that has to do with the whole concept of pulse oximeters too, by the way, which is different. it's a different way of measuring oxygenation. It's not a direct way at all. It's using light waves and all this to calculate. So
Yeah,
that's the whole.
I don't think people are, drawing blood in their home to.
No, but if you use a pulse oximeter for whatever reason, make sure you know how to use it right. Because there's a lot more into it than just sticking it on your finger. You have to know if the waveform you're getting is a good one. Because all the data, the number that you get is based on how good the reading, how good the device is picking up what it needs to pick up. So
Yeah.
it's not like magic where you just put it.
It's totally like magic. That's why you can go buy the $1.99 device from eBay from Hong Kong.
Yeah, they're getting.
I don't think that's actually accurate. I think they're like $6, but.
I have a pulse oximeter here, which I was gonna demonstrate while we were talking about oxygenation and stuff, but.
And I bet it was not $6 from Hong Kong on eBay.
Believe it or not, I paid $14 for this one.
Oh.
And it's really good. And when I was working as an RT in the hospital, these have just been invented. This is like 10 years ago, so technology's made it to where everyone can have a pulse oximeter. But they're not allowed to sell them as medical devices, so they sell them as fitness devices, which I thought was pretty clever. Every athlete, every runner should have their own pulse ox. So anyway, I was going to try to get a reading while we're talking here to show you what I mean by waveforms. But I don't know if this thing's going to do it because my finger is kind of cold.
I was going to say, if you were doing that on me right now, it probably would not work.
Yeah, I can't get it because my fingers are like, your fingers, the extremity that you put it on has to be perfused with blood. So it has to be warm.
Okay, so you have to sit here and do jazz hands for the next
Yes, you have to wake them up.
Warm up, do the jazz hands for a while, and
yeah, one of the reasons I can't do it is because I don't know if you can see this where my camera is. This is where they do blood gases. They do it in your wrist. Mm-hmm. This is the artery they use. It's called. Any guess what it's called? This is a radial artery.
Okay.
It's an artery, not a vein.
Yeah.
You go to feel for a pulse. It's actually the pulse you're feeling when you put your finger on it. That's an artery.
Okay.
So because I've been stuck so many times for blood gases, that everything distal to that, everything on the other side of my fingers, where you take a pulse ox reading, it's not accurate because it's not good circulation.
Oh, yeah.
Because the pulse
they screw you up.
Yeah, pulse oxes work off the pulse. That's why they're called pulse ox.
Yeah.
They take your heartbeat and they calculate your saturation from that. Huh. Basically, they use that as a waveform to make sure that they're actually measuring arterial blood and not something else. So. That was way off on tangent there.
Okay, I like tangents. Yes. Alrighty.
One for you, I'm getting tired of talking about.
What?
We need a question for you that you can answer better than I can.
Yeah, you know.
Clinically, stuff.
Okay, well I can. Oh, sorry, I'm just getting instant messages.
Get over with it. Move on.
Well, maybe we can get a guest on here now or something.
Yeah.
Have someone come join us and join the excitement. Yeah. So, okay. So here's one. This was kind of a joke from one of my friends. I think it was kind of a joke. The phrasing makes it a joke. So he said, "How will asthma affect my smoking?" So of course the question should be flipped. Asthma won't affect your smoking because you're going to do it regardless if that is your choice. It's like everything else. You can do whatever you want with asthma, including smoke, even if it's not good. To reverse the question, how will smoking affect your asthma? Not well. Okay, well this comes back to if we'd like to diverge into story time for a while. Steve and I went to Vancouver in August, and we had this condo, and the condo was, first of all, it didn't have air conditioning, so we had to keep the windows open, and the neighbors just, smoked outside all the time, and we would try to like sit on the balcony thing upstairs, and like talk and hang out and whatever, and eat grilled cheese sandwiches, and like these people were like smoking um, outside of our place all the time, and I mean, I'm sure there were other factors involved, but I know that like I wasn't, for I was okay for the most part but like when we were, at the condo, like my lungs were totally not happy with the whole smoking situation, and that's with me indirectly taking in all the crap. So,
It permeates through everything. I mean, through
yeah,
walls, through. I mean, I can smell a cigarette a block away. Even when I'm in my house, I can smell a cigarette down the street. It's so. I
yeah,
don't know. I guess some of us are more affected by odors, but it's not good if you can smell it. I mean, if you have asthma, you shouldn't be around it, really.
yeah,
I mean, if and if you smoke and have asthma, you really need to quit because I think the damage would be more permanent if you smoke, especially the longer you smoke.
yeah,
End up with a more chronic lung disease later or whatever. I mean, yeah, that's as far as I'll go in that topic. But
yeah. All right. There, I was kind of able to weigh in on that one a little bit more. So this one, okay, I can weigh in on this one too. So this one is I've tried multiple medications and my current treatment is helping, but I've seen new medications and I'm wondering if it's beneficial to try them. Um, personally, I've tried almost all of the like kind of normal asthma medications out there, um, and like because I was on Symbicort and it was working okay, and I was like, I think I no, I wasn't on other stuff with the Symbicort yet, but I was on Symbicort and it was okay, and then I switched to Advair just because I wanted to see if it worked better, and it was like terrible. Um, Advair doesn't like me. Um, and then I went back on Symbicort, and then I stayed on Symbicort and like Qvar and Atrovent and whatever for a while, and then recently Zenhale, which is Dulera. Is that how you say it in America? Dulera? Yeah. That came out last year or whatever, and I asked my respirologist to let me try it, and obviously she was like, yeah, because it's practically the same as Symbicort, but a little bit different. Um, I mean, if you're not happy with how your treatment is working, why not try to change it? You can always go back to the previous method if it's not good.
yeah,
Um,
you have lots of money.
well, okay. Well, I guess
Um,
if it
I'll,
adds some context, the person asking was Canadian. So
oh, okay.
yeah, I guess I mean that's definitely also relevant too, which is I'm spoiled and I don't think about it because I don't pay out of pocket for medications, right? So I can afford to take Advair for 2 weeks and it maybe cost me a $2 copay. Like, it's welcome to Canada.
Yeah, I don't. You're right because in America, you're kind of depends what your insurance will pay for. I mean, we can all pay out of pocket if we're rich. We could, but
Yeah,
you insurance companies are going to go with the true tested, the cheapest they can get, the one, you know what I mean, the most bang for the buck they can get
yeah,
type of drugs they're going to carry in their formulary. So, I'm the same way. I mean, I use whatever they'll pay for, whatever the co-payment is the cheapest on.
yeah,
Uh, and there really is only one bronchodilator. There's only one beta. There's only one rescue, or however you want to call it. And we know what that is, and it's not generic yet. Hopefully someday it'll. Yeah, exactly.
mine is penguins
I
because
mean,
I'm
there's
I'm
there's no alternative for albuterol unless you go back to primatine or some other weird drug. But
this one has flowers on it and a monster.
okay.
I may have once pimped Steve's inhaler in an airport.
Yeah, I use Pro Air. I don't know. I guess I could get what you have. but our insurance pays for the Pro Air brand, I guess.
Because we have in Canada, we have well, because you have Zopanex, or is that how you say that?
Yeah, yeah,
Yeah, because you have that in the U.S. We don't have that here.
yeah. I don't know, and some people swear by it. I wouldn't. I think it's too much. I think you need a rescue type of medicine, which is only one out there, and I mean short acting,
Mhm.
and maybe you need the longer acting. But if you're taking the combo steroids anyway, you don't want to be like overdoing it. So
Yeah. Well, 'cause- and then yeah, because in Canada we have name brand Ventolin, which is what I have. And I'm not even gonna lie, the reason I have name brand as opposed to generic is because it doesn't taste as crappy.
yeah, that's perfect.
Um, and I think that's mildly important,
Yeah,
given, you know, so you have to be taking stuff.
I
Um,
actually taste it. You must be just really sensitive to taste.
well, I think that, but I mean, I don't have one. If I do, it's like super expired, but like it tastes like bug spray.
Oh yeah, that's not
Yeah,
good.
and I mean, and it tastes like bug spray to the point where even if you're using a spacer, it tastes like bug spray.
No, no. Yeah,
Um, I mean, well, and like Atrovent is the same way actually, because Atrovent is gross.
I mean Atrovent, MDI
Yeah,
inhaled. Yeah.
yeah, yeah. So this leads me to another story of ridiculousness. So last week, when I was in California, hanging out with Steve, my my air chamber is in my backpack with a pack of gum. And now all my inhalers that I take through that air chamber taste like mint. It's beautiful. I don't know why I haven't figured this out
Well, I
prior
was
to
going to say,
now.
don't give the drug companies your secret
Oh,
because
they got to watch like this much of the Hangout to be able to see my secret. So
yeah,
there are two of you watching right now. There was a third, and they've just disappeared. But if you put your spacer in your bag with a pack of gum, I was using. It's not out here right now. I had a pack of, I think it was Stride or Five or something, one of the like cardboardy packages with the like big strips of gum in it. If you put that in your bag with your spacer, all your inhalers will taste like mint. And I think this is quite important, and I like this discovery.
well, at least you're using a spacer.
Yes. Well, you know
And
what though? Like I'm bad. Like half the time, I use it with all of my like my regular medications. Half like 90% of the time, I don't use it with Ventolin, which is probably when I should be using it.
as long as you create an airspace, you're probably okay. I mean, that's all a chamber is anyway, just
Yeah.
contains space. So.
Okay. So like, what's because I'm pretty sure. Well, I'm pretty sure you don't do it. What's your take on the whole open mouth situation? Because I feel like I'm going to spray myself in the face.
Um, you get good at it. I mean, it depends how often you do it. I mean, spacers were only invented, I don't know, 25, 30 years ago, I guess.
Mhm.
There was no one even thought about it, you
Yeah.
know, uh, because they didn't have the technology to measure aerosol or not now use particles, powder, penetration and all that kind of stuff, how deep it gets in the lungs. So I know that because to be honest with you, I only use a spacer for certain drugs. I'm like you, and I don't have a purse usually.
Yeah. Usually.
I know, so unless I'm going on a trip or something, I don't carry a spacer with me. So I try to, create an air, like you said. And I know that I'm probably getting half of what I should be getting. I mean, typically you get very little anyway. Even
And
if
then
you,
and then the number goes down when you're trying to use the sneaky technique when you're, on a train or walking up a hill.
yeah, but it must be working because I do get relief, and I'm sure you do too.
Yeah.
Like we were walking up to Chinatown. It's funny because we have, I don't want to say gaydar, we have radar for asthmadar, whatever you want to call it. We know when the other one's trying to be sly with. We have to think of a term for that. Remind me.
Yeah. Okay. We got to think of that.
Well, we have this whole thing of, not just us, but every asthmatic who's had the disease for a while has a way of, unless they want to draw attention, and we know people like that too, but make a whole scene out of
Yeah. No.
blowing their inhaler. But So I mean, we have a way of doing it really sly so people won't see that we're doing it, including each other. But
We catch each other though.
yeah, because the sound is embedded in our brain. So even if we don't see the person doing it, we can hear that faint sound that no one else would be able to hear. Of the,
I'm waiting for the day that I'm waiting for the day that I hear the sound in the wild. Like, like when you're like hiding in the public bathroom taking your inhaler. Like, I'm waiting for the day that I hear it from someone else.
well, remember when we were in Vancouver, when we were on the mountain, when we were on the ski list,
Yes,
and I
yes.
said, "You guys got an inhaler there." The reason I knew is because I heard it. I'm going the opposite direction, and we're way off the ground and everything. And that's what made me turn my head to look. And sure enough, I saw him doing it. And he was trying to be really stealthy about the whole thing, even though he's on the top of a mountain, and who cares if anyone can see you? But so, I mean, even this, and he was an older guy. I was taking a hit off of it, and he was trying to be really secretive. And I totally nailed him on
I
it.
know we should have like chased him down later. Like,
You know,
got him to join the bad asthmatics. Like,
I think about that all the time, but I think of why I have to hide it.
yeah.
And for me, it goes back to childhood, is that I'm just embarrassed. I don't want people to know.
Mhm.
I don't want to ever draw attention to myself that way.
Yeah.
And so I don't care how, I'll suffer. I'd rather suffer if I'm on a crowded plane or something and like
Yeah.
immediate relief. I'll wait till I'm super sick to take a hit or till I can be away from people to do it because I don't want them to know. Isn't that fair?
Exactly.
I mean,
Exactly. Yeah,
so,
like, no, because I do the exact same thing. Like, it doesn't make sense at all, but like,
yeah, so I don't know what it is. And, people like us who use our inhalers all the time, you would think it would be different. Like we're just used to it, but no, 60 years I've been going on this. I've been taking inhalers for 50 since I was 7, whatever that is, 52 years.
yeah,
Uh, and I can never remember a time where I like took it out, shook it, like do all the things you're supposed to do to prep before
yeah,
you hook it up to a spacer or whatever, and then do the breath holds and all that kind of junk. I mean,
yeah.
you're supposed to do that, and as an RT, that's what we teach, of course. But
Oh, of course.
in the real world,
Yeah. Well, oh God, yeah. The clinical world is 100% different than the real world.
yeah, exactly. So
Um,
we make up for at least I make up for it by taking twice as much if I have to, which is called double breathing, which they don't want you to do because they don't know. It's really hard to OD on something you inhale. I mean, on an asthma medicine. So
yeah.
there's the
Well, I
dose.
mean, especially too, like this stuff, like what your heart rate's gonna go up. Like, that's pretty much it.
Yours will go up. No,
Yeah, yours won't. Mine will.
it goes down. No, how funny.
Yeah, yours will. Yeah, mine will. Yours won't.
That's a whole different thing. That's a good topic for some time. But this whole idea of being embarrassed by your disease, which is so common anyway.
Yeah,
I mean, it's if you picked out 10% of the population in any open space, you can assume that 10% of them have inhalers on them. Well, I
yeah.
don't know,
Well,
maybe
I, I,
not.
I would say less than that because I feel like half of them probably don't even like own an inhaler, but they have asthma.
Well, other than forgetting your meds or whatever, is there ever time when you don't have an inhaler on you? I don't know.
I always do.
I do everywhere, 24 hours a day. I have to know where my inhaler is. I always have one.
Would this be evidenced by the fact that I have two right here?
Yeah. I mean, it's stuff like that.
Yeah, I
But
mean, like, because that I mean, that's not even like intentional. That's just like I have one lying on the end of the kitchen table, and
yeah,
this is the one that I threw in my pocket this morning. Like, you know, they're just like they're everywhere.
yeah.
And
You
I
know,
mean, the nice thing is I do recall a time where like Steve and I when we were in Vancouver we would just dump all of our junk out of our pockets at the end of the day onto this table thing. Okay, sidebar here for a minute. This table had a lamp on it, and do you remember the table I'm talking about?
in the
in the condo. Okay, so the table had this lamp on it, and the lamp was pointing upwards towards the wall so that it could illuminate the artwork on the wall. Anyway, needless to say, we never turned the lamp on. I'm about 95% sure. But this table that it was on, it was like on a desk or something. We just, at the end of the day, we just dumped all the stuff out of our pockets onto this table. And so at the end of the day, there were like phones and cameras and like inhalers and whatever on the table. And, but I mean, the nice thing about hanging out with people with asthma is that you can like cover for each other. So I remember one day we were like heading out to like find food or something, and we were walking up the hill, and you just kind of like looked at me and like you did the classic like you kind of like hit your pockets or whatever, and then you were like, "Do you have medicine?" And I was like, "Yeah," and then we kept walking, and that's it's all that happened, and it's just like the most like random tidbit to remember, but you like. It's why we need to hang out with more asthmatics that actually carry inhalers. Because then you never have to make sure, well, you have to make sure one of the two of you has an inhaler. And the chances are pretty good when it's the two of us.
Yeah, if I actually get to the point where I don't freak out, but I get nervous. If I'm walking somewhere and I don't feel my inhaler in my pocket, I'm like, my heart actually goes faster because I'm going, oh my God, I walked a mile away from home or whatever, and I don't have my inhaler. And even though I'm breathing okay, I'm like, not panicking, but all these things are racing through my head. Like, what should I do? Should I go back to the house and get it? So I actually have to stop and like cool my head and say, this is ridiculous. Just don't think about it, and you won't get short of breath, and you'll make it home. But I mean, that's how dependent.
Yeah.
The stuff.
Well, because I mean, like and it's. I mean, I'm at the point where I'm just like, if I forget it at home or whatever, I'm like, oh well, whatever. I mean, depending on how long I'm going out for. But I know that it's like, I don't know, it's like last week or something, or earlier this week, whatever. And I went out and I was just like, oh, no inhaler, oh well.
See, that's good.
Yeah. But I mean, it's the fact that you even think about it, right? Like, because I would just prefer if I don't think about it and I realize when I get home, oh, look, I didn't take that with me. But it's the fact that you're always like having to cycle through your head and think about it.
Yeah. And you probably wouldn't like, even if you had like this fast, severe attack, or your lungs just started, it probably wouldn't get that bad where it would kill you. I mean, you'd be very uncomfortable.
Yeah.
If you relax and
Yeah.
You could easily wait, for someone to get you the meds or whatever. But I don't know. Having actually almost born with one in my head, I mean, I can't remember a time that I've not been without it ever.
Yeah.
And the times that I have lost them or whatever, yeah, it's like a big deal,
Yeah.
So, and it's hard to explain to people that don't rely on them, but they're like, I don't want to say the difference between life and death, but the difference between suffering, suffocating basically to some degree, and being able to breathe halfway normal. That's what comes in that little bottle. And so, I mean, that's everything when you have bad asthma or tracheotomy or whatever. So, let me tell you one little thing is related to fitness. And I wrote about this on my blog a few years ago when I did the Portland Marathon. I think the second time. Yeah, I did it the second time with my friend, and I lost my inhaler.
I remember this story.
You remember that?
Yeah, I was gonna ask you to tell the story.
Yeah, because I thought I was holding it in my hand. I thought if I hold it in my hand, I won't lose it. Well, that was a stupid idea because you're focused on everything else. You forget what you're holding in your hand. So anyway, I got to I think it was about the 9th or 10th mile, and I had to use the porta potty, and I must have dropped it when I had to use my hands for something else. So I didn't think about it until I was about a mile or two away, further up the course, right? And all of a sudden, I started to get short of breath, and I needed a hit off the inhaler. And I didn't have it, and it dawned on me, oh no, I left it in the thing a mile behind me, and I was contemplating, should I actually walk back to see if I can find it? I mean, I'm in the middle of a marathon race, right?
Yeah.
I'm not running, I'm just walking it anyway, but I thought, I don't want to add more mileage by going the wrong way.
Yeah.
Which actually did. I backtracked like a half mile because I was panicking for my thing. I thought, oh no. So it's going through my mind. I have to pull out of the race. I can't do this. I don't have any medicine. They're locked up in my hotel room. So luckily, I had my cell phone with me, and I called a good friend who just happened. This was in Portland, right? And she just happened to be up there with her family. She was watching the race, or she was getting ready to come to watch the race. And I called her and said, "You need to help me. I don't know what to do. I think I have to withdraw from this race." So it was like, I think it was about 8 o'clock in the morning when this happened. So this is how cool she was. She went to a pharmacy, a local pharmacy. It was a chain one, and got them to open the pharmacy early. It was a part of a bigger drugstore thing, and they couldn't actually give her a prescription, but they were able to give her a Primatene Mist, which you could still buy over the counter. So she took her moped. She went to the store. And they gave her the medicine, and she met me on the course with the Primatene Mist, and the whole thing took her maybe 30 minutes.
That's awesome.
And because of that, I mean, it's Primatine's awful stuff, but it gave me what I needed.
Mm-hmm.
Because of that, I was able to finish that race. And I don't know, it strikes me as funny, but
yeah.
Needless to say, after that, I always carried 2 or 3. I would tape them to my legs. I would do everything I could.
Yeah.
That wouldn't happen again, but.
Well, no, because I remember like when like the couple of races I did, I remember like I thought about your story like before them, and I took 2 with me. I was just like, don't have to worry about anything, like I mean there was a time too that I'm assuming I had more than one with me, but I'm pretty sure there was a time, I can't remember even where I was flying, but I almost lost one before I even left the airport here, and I was like. I was just like, that's why like I always have more than one even with me if I have any kind of bag. Like,
except when you visited last year.
No, I had inhalers.
Oh, you did? You had albuterol?
I had inhalers, but my battery for my neb was dying, and I left the cable at home.
But did you have albuterol in the inhaler?
Yeah.
Oh, so you had that, but it wasn't working?
No. I mean, I was like, taking like 10 puffs of that stuff, and it was just like a little bit, but yeah. Yeah, but I mean, so like, I don't know, they're all over the place. Okay, so let's go on to rescue medication related question. Because that's what we're talking about. Yay! So it's a two-parter, but so if you're short of breath while lying down or resting, but not wheezing, is it still asthma or is it something else? It could be both.
Yeah, depends if you're an asthmatic.
Exactly, it depends.
If you're asthmatic, it could be a million other things. Not a million other things, but it could be a few things that I can.
And if you're not asthmatic, it could be asthma.
Yeah, exactly. That's what we call orthopnea, which I actually just use that word, I think, in a recent blog post. It's positional orthopnea, positions related to difficulty in breathing or whatever. So, and it's pretty common. Anyone with lung problems, if there's significant lung problems, you're going to have a hard time breathing when you lay down, or if you're not in an upright position.
Mm-hmm.
So, but if you don't have symptoms of asthma and just shortness of breath, it could be your heart, which is you could have congestive heart failure. You can if you're overweight. This is a big one too. If you have a big belly or something, and it's harder for some people when they're laying down. So it's just positional breathing stuff, and I'm not sure. Yeah, you can't tie it only to, like you said, to asthma. In fact, I would say most asthmatics, unless they're flaring, don't have a problem laying flat.
Yeah. Because I mean, I see, and this is what's weird with me though, is I'm not sure how related to asthma it is for me, or just related to other things. Because what had happened was like several years before I had asthma, I just got used to sitting because I had like knee surgery, and I just got kind of used to sitting partly propped up, but now I think it's partly related and partly not. I still can't sleep unless I have more than one pillow or something behind me.
Yeah. That's orthopnea, and but you're an asthmatic, so.
Yeah, well, exactly. But I guess with me is I started doing it before I had well, before I knew I had asthma. But like just because I kept falling asleep when I was sitting there after I had surgery, right? So it was like,
Oh yeah.
I wonder how much is like actually like because I know now it's partly linked to my asthma, but I think like from before, it just makes me wonder like would I have kept doing it, or would I have eventually just gone back to like sleeping normally? Because
I don't know.
I
I think
think it just becomes like habit.
yeah, I'm as you know, I'm having issues with sleeping right now, so I'm hoping to learn more after my test next week.
Yeah.
But I've had to basically sleep sitting up for the last 8 or 9 years, and it's getting worse. It's getting to the point now where I can only lay flat for maybe 15 minutes,
Ugh.
even at baseline. Like right now, if I had to lay down like on a gurney or someplace flat, I could do it for a few minutes as long
Yeah.
as I'm totally on my back. But I can't. It's like I can't. Even though I love it on my side, I can't do it at all anymore.
Hmm.
It sucks because you get uncomfortable. I mean, it
Yeah.
gets really achy when you can't change positions all night. And
Yeah. Well, I know that you can. There's a video tour on my YouTube channel of the condo tour when we were in Vancouver, and you can actually, if you watch the video, you can actually see that Steve and I both have these like piles of pillows on our bed.
well, well, yeah. I don't. When I'm in the hospital, the hospital beds, backs adjust on them,
Yeah.
sit up. So I know just like during a severe attack, nobody can lay down. But
No.
like at baseline, I don't know. It just it could be asthma. It could be a bunch of other things involved. So
Yeah.
I wish I could answer that question more, but
Yeah. So, okay, so part two of that, so related to shortness of breath while lying down, um, is it okay to wait it out or sleep it off, or should rescue medication be used? My opinion on that would be if you can fall asleep, then do so.
yeah. I
Just because
mean,
I know if I like, and mostly for me, it's because like the bronchodilators make my heart rate go up. So if it's not one thing, it's another. So I either can probably have a higher chance of falling asleep while being short of breath versus having my heart rate go up and then just
uh,
having to feel that, right? So I usually wait it out until I am not ever going to fall asleep again, and then I'll take it because I'm not going to fall asleep anyway. So, I mean, occasionally, like for mild symptoms, I'll take like one hit in like the middle of the night, and it's totally fine. I don't have that same reaction. But if it's like right as I'm trying to fall asleep, it's different because I've just taken all my other medications. So,
so,
um,
so to answer that, was is it is it okay to take medicine? Is that what they asked?
is it like I guess is it okay to wait it out, or should you take medication regardless?
Common. I mean, you have to go with what you can do. I mean, personally, I can't sleep when I'm short of breath, unless I'm like critically sick. Because then what happens is you get narcosis. Your CO2 actually starts climbing, and so it makes you feel real. At least for me, it sedates you. It's like a sedation, but it's not a comfortable sedation.
No.
It's like drowning, but you
Ugh.
have to do anything, so you just fall asleep that way.
Yeah.
So I personally, I would take if I was short of breath, I would take the inhaler to see if it helped.
Yeah. See, and that's like I guess that's where we probably differ a bit is that I try to I wait until I know I can't fall asleep and then I take it. Like
Yeah, I don't know. And that's a good point because I'm not sure that's just because I care about you. I'm not sure that's the wise thing to do, even if your heart's pounding from the medicines. I mean, if what's causing the breathing discomfort, if it's asthma or your lungs clogging up, and you're like ignoring it because you don't want the heart.
right, but like I mean that's only when it's like super mild, right? Like I'm not if it gets worse, I obviously take
That
medication
would,
right away,
yeah,
but
okay. So I guess that should be the distinction because you could you I've heard of people actually dying of asthma while they're sleeping,
Yeah.
or they just woke up, or they were trying to doze off.
Mhm.
And so people do die that way, believe it or not. So that's the only reason I throw that out there.
Yeah. No, I mean, I completely understand and believe that. Like,
But but I know what you mean about pounding, because that drives me crazy when my heart's pounding, or if
yeah.
you're feeling these really weird arrhythmia, these palpitations that aren't normal. That would drive anyone batty. Um,
Yeah.
um, but that aside, though, there's no way I could fall asleep, and that's why I'm so sleep deprived. Actually,
Yeah.
falling asleep from pure exhaustion is not a good way to fall asleep.
No. No.
So if I
Well,
could change,
and then you wake up and it's just like it's not a good scene when you wake up either. Like,
like, this is off the side, but have you ever? And I asked Sally this. She said it's pretty common. Do your patients complain that they're short of breath in their dreams, or that they're gasping for air in their dreams? In other words, is the sensation, going through your subconscious,
yeah.
pushing into your thought process while you're asleep, or not thought? Is it going around in your brain that you're? Is it coming to the forefront that you're actually short of breath, and is that what wakes you up? And apparently, yes.
Oh yeah.
People dream that they're short of breath, and it actually wakes them up, and they actually are short of breath. So
Yeah.
it's weird, because I always think of it. I guess you're just not in that deep of a sleep then if that happens. I don't know, but apparently it's very common for people
Yeah.
to be short of breath in their dreams. So you see, you can't even escape it when you sleep, which totally sucks.
Yeah. Because I know I can't say I've had it frequently, but I know I've had that happen like, you know, at least a few times. So,
Yeah,
and it's something that I never, like I don't, just because it happens so infrequently, I don't think much of it, but like I totally can level with that though.
yeah. Ugh, anyway,
Yeah. All right.
we
Okay,
can have
so
an
take
hour.
your inhaler.
Yeah, take your inhaler.
Don't be me. I'll think of that next time. Okay, so oh look, we're almost at the end here. This is that's crazy. All right. And these are just silly questions from my friend Katie. So Steve, we get to talk about physical activity again now.
Oh, good.
And even if it doesn't relate to asthma, which is probably preferred. A sidebar on this. So we went to the Jelly Belly factory last week,
Oh, God.
and we were discussing the existence of Jelly Belly sport beans. I was eating jelly beans before this call, actually, which I don't know what that says about me, considering. Oh, it's earlier for you than it is for me. So,
Yeah.
um, yeah, but we were discussing the existence of sport beans, um, and then I found sport chocolate. I don't know what this has to do with anything, nothing at all. But we're talking about physical activity. Um, so this question is from my friend Katie, and it comes with a backstory on my part. But the question is, can you please tell me the influence of the hokey pokey on disgruntled high school gym teachers? And Steve is like, what did I get myself into
But
on?
what do you mean by hokey pokey? What does that mean?
Oh, Steve, do you not know the dance?
Yeah, kind of. I know the lyrics.
Leg, put your left arm in, you take that whole scene.
Oh, kind of.
Okay,
Yeah.
so in grade 10, when I didn't like to get off my ass ever, um, I was in gym class with a few friends, and we had this like fairly young dude was our gym teacher, and he was like super competitive. And like one day, I can't remember what we were playing, but one day the team he was playing on like scored a goal in whatever game we were playing, and he ran around the gym in circles, yelling with his arms up in the air, and then he ran into like a mat on the side of the gym, and then the mat fell down on top of him, and he just laid under the mat giggling for quite some time. And it was like full on like man giggle. It was excellent. Um, but he like super competitive dude, and you could tell he was like super pissed off by like my friends and I, because we were like all not interested in physical activity at all. And so like I don't know. So every class that we'd go and we'd ask him if we could do the hokey pokey in class, and every day he said no. So So the question was, can you please explain the effects of the hokey pokey on disgruntled gym teachers? And Katie, I'm pretty sure that this dance makes gym teachers like the one in question more disgruntled. Um,
To see their
Personally, sorry.
to see their students flailing about and
Yeah,
um,
yeah. See, I like this question because there's nothing to do with asthma. It just has to do with being ridiculous, and I'm totally okay with that.
and where's the Jelly Belly part fit in, or did I miss?
It doesn't fit in anywhere other
Oh,
than that I thought about it.
oh, because you were thinking of sports beans and the
I was thinking, yeah, I was thinking of the sport beans.
the thing I
And
have against sports beans, because I'm all for fitness, is that it promotes sugar intake as a way to accompany exercise, which is ridiculous. And even though they say you're getting electrolyte, you're getting a ton of sugar.
well, and you're
Weighing out.
we should look into the nutritional content because I wonder if it's like well, first of all, it's probably still 4 calories a bean, right? Because they probably just made a jelly bean and then like added salt to it. Like, do you think they're adding like potassium or are they just adding sodium to it?
Oh, I'm sure there's potassium. I haven't looked at the ingredients, but I'm sure it would have to have potassium in there. If if they're promoting it for runners and all that, because that's one thing that you need
Yeah,
if you to prevent muscle cramps and everything else. So I'm sure it's Gatorade basically. It's all their formula.
Gatorade in jelly bean form.
Yeah, but what irks me is they're using candy as the, you know what I mean, as the bait
Okay,
basically.
well, and then think of it this way too. Like, what? I wonder how many people have like choked on sport beans while
Yeah,
like doing a race or something. Like, you
gelatin.
know, yeah, like I mean, because like liquid and gels are like one thing, but you have like beans that are completely like the perfect size to like choke
Yeah,
you.
and
Um,
the stuff in gels is a little better for your body, even though they're nothing but sugar too.
yeah,
They're they're the type of sugar they are. It's actually easier on your system.
right. Well, and I
And
mean, like, I would assume they would work quicker than jelly beans anyway, because there's
yeah,
less like
exactly. And
there's less substance to absorb.
yeah, now I'll be curious if they have caffeine in them too, because most gels have caffeine in them too.
Oh yeah, that's right.
I don't know. I can't badmouth Jelly Belly because they're my favorite jelly bean. But as far as fitness goes, we know each other's thoughts on sugar in general. It is bad for you. It is poison, basically.
And
But
we know each other's thoughts, and we also know that we both enjoy it very
we
much.
enjoy an addiction that's hard to kick it out. But we try to do it in some moderation. But
Like I actually counted out. I counted out 8 jelly beans when I was eating jelly beans this morning. I mean, that's something, right? Like
oh yeah, and
it's like it's just like you have to be like even if you don't do everything right all the time, you just have to be mindful of what you're doing. Like,
yeah, it's probably better than eating like a huge cupcake or something. I mean,
and I like cupcakes. You know what? I like tiny cupcakes though better than like giant ones because like I don't know, giant cupcakes are giant. um, yeah, I had something else to say. I don't think it was related to choking on jelly beans, but yeah, I mean, no, I think that like, and it wouldn't. Okay, well, Jelly Belly can make gels. Like, they can just spell it differently.
well, we were at their store, so we know everything they can make with it. I mean, they thought of everything.
Oh, oh my God, that store is insane.
Yeah,
Um, yeah, like mind blowing. So many friggin' jelly bean flavors, and most of them, well, not most of them, many that I would not want to consume.
yeah, and I learned that because I bought, I think, a third of a pound actually, which was gone in a day. I forgot to calculate how many calories are in that third of a pound, but it's going by weight of a jelly bean and stuff. But one thing I did notice is that you can't mix the dip. The chocolate dip do not taste good with a non-chocolate dip.
No, you know what? I put mine in separate bags.
Ugh, that was disgusting. Because Jelly Belly, they pride themselves that you can just grab a bunch of multi flavors and it's okay. Not with the. At least I
Yeah,
didn't like it at all. I mean, alone they're okay, but you don't mix nons with chocolate. That's
No. Okay,
chocolate.
what kind of chocolate ones did you get?
The cherry, which I thought, because I bought them here locally before at my store, but this time around they didn't taste the same. They taste too cherry to me. Before they tasted like chocolate covered raisins.
Okay,
And this didn't have
because
the
I
same.
didn't I didn't get cherry ones because I don't like cherry,
You got strawberry.
but I got strawberry and I think I found raspberry too.
Yeah.
And I got one other kind. I can't remember. But they also had like I don't think I got any, but they had like coconut ones too, which it was kind of weird though because it is May, so it is Get Fit May, so I'm trying to like put all the food and all the workouts into my fitness pal, and I was searching for chocolate covered jelly beans yesterday because even though I'm eating a bunch of crap, I'm still putting it into my fitness pal for you know for whatever reason to be authentic, I guess. I don't know, but so I put it in there, and the only ones that popped up were the coconut ones. I was just like, why would you not just put like assorted because they're all gonna have the same nutritional content.
Oh yeah. I don't know. They're supposed to use like natural ingredients in most of their stuff.
Oh, that's
That might
fascinating.
be wrong, but I don't know. I mean, the coating is the inside is just gelatin. I think,
Yeah.
or when they take you on the tour, they show you all. I think, but I don't know. Chocolate and gelatin doesn't seem like a good combination anyway. Like the soft substance with chocolate, right?
Yeah.
Or rubbery, a consistency of rubber, basically, of a or something like that. This is a weird thing. I don't even know how they make it stick to the bean.
Well, yeah, I mean, because I guess you think about like chocolate covered raisins, like they're kind of
Yeah, there's little grooves and stuff.
yeah. I was gonna say they're kind of like rougher texture to make, I
Yeah,
guess, the
exactly.
chocolate stick. But
I
okay,
make
so
it.
that's a question. I wonder if like maybe the beans aren't like normal on the inside,
Maybe they're modified a little. Yeah. And
modified.
it's if you've never been to Jelly Belly and you're a fan of that sort of food, then if you're when you're in the area, you should check it out. It's pretty wild.
So, and if anyone's wondering, these are actually the real types of conversations we have all the time. I mean, we talk about asthma once in a while, but most of the time we just talk about like ridiculous, you
Yeah,
know,
we're curious that way.
like I don't know that have we had like a normal person conversation ever? Like, I'm not sure.
I mean, like serious or like, that wouldn't work. I don't think we've ever. Nah, like no.
No, I don't. I'm pretty sure we have not had any sort of normal discussion. Yeah, like, and it's funny too because I obviously know this, but I feel like despite the fact that we live 3,000 kilometers or whatever that translates to in miles
Mhm.
away from each other, like we've actually been really lucky to spend a lot of time together in person, especially in the last few years. Um, but it's funny because like it's those times that we're together in person that we have like the like super ridiculous conversations, but then we have this like very similar ones on Skype or whatever. When we Skype for occasionally 8 hours, or when I'm in a Starbucks, or like
When I'm in the hospital, we've done a lot of those.
oh yes, yes,
Walking around, introducing you
prefer
to the nurses.
yes, prefer to avoid those ones, however, but
Yeah, but
um,
we have spent a lot of time doing that. Yeah.
yeah, his nurses are always like super cool with being like introduced to me on camera though, so that's cool. Um, I know one time when it was actually my first blood transfusion last May. Um, I was like, I was sitting there with my phone and I was taking pictures to like put on Facebook or whatever because every friggin' aspect of my life is on Facebook. Um, and I was sitting there and I was like, holding out my stupid old BlackBerry, like doing the selfie thing, and my nurse just walked by and she burst out laughing because she thought like I guess that's not what normal people do in the ER, but that's apparently what we do on occasion. Like,
Yeah, I don't do it in the ER, but I've done it everywhere else.
yeah, yeah. Well, I mean, and that's just because I never really except for the last time, I never really got beyond the ER. So They just dealt with me in there and then will let me go home.
You should have been here. That was the week you were supposed to be here, and then you got sick.
No, that was that. Well, the first time was in May, and then June, same thing happened. July, August was the good month. August, I got to go to Vancouver and hang out with you, and I didn't go to any hospitals, and it was good. And September was like
Yeah.
terrible.
It was a bad choice of Airbnb properties to stay at, but that was the risk because you don't really know what you're getting into.
And we were too far away from everything.
Yeah.
But yeah, it's also on this YouTube channel where I think this is posting the Tour de Badass YVR videos. YVR is the airport code for Vancouver. And we went to Vancouver last year. We did some adventures. We saw the guy on the chairlift with the inhaler. We went into a windmill.
We went to the top of one.
Yeah, we went to the top of a windmill. And we ended up on some like hike-ish situation that led us to a beautiful, like, I don't know what to call it, like beach type thing. I don't know.
Oh yeah.
Yeah.
That was weird.
Yeah.
It was forest. It was super long.
And we had no idea where it was going.
We stumbled. We literally stumbled onto it.
Well, we kept seeing these signs that said like 30-foot pool, and we were like, "What is that?" And, like,
Yeah.
and then we went and like it was awesome. So that's in the video. I think that was Thursday. If you want to go and like check that out. And yeah, so that was fun.
The
But
water was fun. I like that.
yeah,
Water taxis. I mean, just getting to places was kind of neat. But
it was excellent, but it was also terrible because, like, we were saying before about being hypersensitive to everything in the air from people. Everyone on the friggin' train thing was like smelly
yeah.
in a variety of ways.
That was fun. That's a beautiful place to go.
Yeah,
My first time there, so
yeah, we should. I think we talked about it briefly, but going to like Banff or something in Alberta, that would like, more mountainy scene. We could also do like Colorado.
yeah. We would have had a blast in Churchill, so you would have loved that too.
Yeah.
I mean, you live in snow, but for someone from California to be in the subarctic, that was pretty
Oh,
cool.
okay. Well, speaking of Churchill, I was gonna send you this, but I felt like I'd sent you 40 emails last night, so I didn't want to send you another one with like a random fact. But so I saw it on Twitter last night that apparently polar bears, when polar bears are angry, they like sound like cats screeching.
Oh wow, I didn't know that.
I thought that was fascinating, and I thought you would enjoy that fact. But I didn't want to send you like a 12th email for the night, so I thought I would remember it.
Oh yeah, I don't. Huh. I didn't know that. I mean, they give you a crash course on what to do if you encounter a polar bear because they walk through town. I mean, this
Yeah.
is like Churchill's like right in the middle of nowhere, but yeah, but I don't recall that part. It was one of the funnest trips I think I had because I'd never done anything like that before, so extreme. And
Yeah.
just getting there was a huge challenge, and also because it was such a random thing. I saw something on PBS and I said I want to do that, and 3 months later I did it.
Yeah.
It's so crazy.
Well, and I mean, to me, the coolest part of that was that, like, you really had, at that point when you were looking into it, you had like no idea where you were going, and then
Oh,
he emails me and he was just like, "So I'm coming to Churchill and my flight goes through Winnipeg," and I was just like, "I live there," like, so it was like, sorry,
no, I was going to say then I met Donna Merrill on the plane back. He's
right, yeah,
Yeah, he's a famous singer in Canada. Actually, he's getting popular here too, I guess a little bit. But I met him
yeah,
on the plane because the plane their planes are a little different way up there. They're not like passenger jets. They're airplanes with propellers and And just the whole airport thing is so different than like an international airport. But there was no room for him to carry his guitar on or something. But we bumped to each other on the plane. I had no idea who he was. So we sat together on the flight back and basically learned each other's life stories on the 2 hour flight. And then I got to meet his wife at the airport and stuff. But anyway, that was a totally fun trip. And then I only saw you for like, I saw you on the way there and on the way back.
Yeah. Well, because I went and I met you at the Sandman.
The hotel,
Uh,
oh, yeah.
yeah, the best hotel. Yeah, I met you at the Sandman, and then we hung out. We got on a bus and we went to Subway, and then we went and like actually saw things the next morning. And I skipped class. It's
Oh,
okay. It was only social psych. I failed that anyway. Um, and and then yeah, then on your way back, I came
because
to
I took
like
the train up, but I flew back.
yeah,
Yeah, I took the train up to Church and then I flew back.
yeah,
Okay.
and then that was when I pimped your inhaler in the airport.
Oh,
If we
yeah,
want to take this full circle to decorating inhalers with duct tape, that's how that links in. Good, look, we've made this story relevant.
yeah. I don't know.
um,
Yeah, this is the crazy stuff that we like to do.
yeah, and I mean, okay, and then it was like 2 months before that was the first time we had actually met. It was like the end of September, and I was in California for Medicine X at Stanford, and that's when Steve picked me up at the airport and gave me the like super rapid 2 hour tour of San Francisco, and then drove me out to Palo Alto, and then ended up kind of by chance coming back and getting me and driving me back to the airport.
Yeah, because
Just for the record, I know how to take the Caltrain now. So
oh, yeah, cool. Because I live a long way from Stanford.
yeah,
Yeah, I live about an hour, a little more than an hour, with no traffic
yeah,
in either direction.
yeah. We took the Caltrain to the airport, and I mostly enjoyed that experience. So
Was that the first time that I met you in person? Or,
yeah,
no, I guess it was. Because we had chatted so often before then. It was
well,
like
yeah,
anyway, but
and that's what we had talked about was that it didn't feel like it was the first time we had
yeah,
met in person because we just like talked so much, and that's the joy of the internet.
yeah, not but well, we didn't, I'm sure you didn't know what to expect anyway. Or I mean, you can talk to a person a lot online. You really don't know. It was harder for you than for me because obviously I'm a lot older than you, and you were over 18, I think. Oh yeah,
Yeah,
when
I
you first,
was. Yeah, I was 20. Yeah,
yeah,
I was 20. Um, yeah, I
so
mean, like I hadn't done a lot of like meeting people from the internet at that point too. Like right, like now I've like met like dozens of people from the internet just
no,
and I'm
I've
totally
even met some of your friends
yeah
in person
yeah
that I knew before.
yeah yeah. That
Yeah,
was last Saturday. We met up with a bunch of my friends from the Bay Area and went for food and yeah, it was a good time.
yeah, they were pretty cool.
Yeah, and that's, I mean, I love that I have friends all over the place too, because like, and then my mom, of course, is just like, is this a real friend or an internet friend? I'm just like,
Not real friends or anything.
no, I'm like, they're all real, mom. Like,
So was it asthma that actually brought us together?
it was because of our blogs, because I found your blog, and then because remember you're the reason that I am no longer like completely physically inactive and sitting on my butt forever.
But I started my blog not for asthma. That was secondary. I started because of the whole walking thing.
Yeah,
Because I was like real proud of myself for like wanting to attempt something like marathons and stuff. So that's why I started the blog.
yeah.
Is just to like put down my workouts and
Mhm.
see my progress, and then the whole asthma thing just happened by accident. I mean,
Yeah,
you knew I put that on my blog that yeah I have asthma, and that's why I can't run, so I walk. But that was pretty much the extent of it.
Yeah.
Then people started asking more about the asthma part of it, so it kind of morphed into that.
Well, then it's, kind of, I guess once you say you're an RT too, you can't really avoid it that
Then,
much anymore.
just by coincidence, I'm an RTU, so
Yeah.
believe me, that's been a mixed blessing.
Yeah. Oh, I can imagine.
Because when I get sick, I have to be treated by the people in my profession, and it's a pretty small knit community, believe it or not. I think
Oh,
there's
yeah.
30,000 in California alone, but I know a lot of them.
Yeah.
The word spreads like crazy, so when I'm in the hospital, especially, and they hear I'm an RT, if an RT hears I'm an RT. Not to mention doctors are intimidated too, a lot of them, if they don't know. I mean, even though I'm not a doctor, I'm just a technician basically, or a therapist, but any medical person is going to intimidate them a little bit. So,
Yeah.
so it's been good and bad. I won't say it's been 100% good.
Well, I mean, I think though too, like, and it's not only that you're like a medical professional, it's just like I think they get kind of intimidated when you start asking too many questions.
Yeah,
Like, because I know, because obviously I'm not at all a medical professional, but like I'd be asking all the people in the ER like all these questions, and they were just like, they would answer them, but you could tell that they were just like, why are you asking all this? Why do you know all this?
I'm surprised they didn't ask you, are you a nurse? Are you a medical person?
Yeah, no, like I don't know, but you can tell it drives them nuts though. Although there was the time after my first transfusion, like the morning after the I can't remember who I was telling this. I don't know if it was you or someone else, but the nurse came in to give me a shot of Lasix, and I didn't want any more Lasix because I was going nuts. And like, so I was just like, no, no more, no more. Let's have a dance party. And he was just like, he had no idea how to respond. And like, and of course, I've just had 3 units of blood, so I'm ready to go.
Yeah, that would drive me nuts sitting in there for all that because it takes a long time to get a unit of blood.
Well, and that was because it was my first transfusion too. They were doing each unit over 3 hours, which was like
Oh no. Oh,
forever. And I mean, and that's why that because that whole thing is on YouTube because I didn't feel bad at all just because I'd gotten so sick so gradually, but like I didn't feel bad at all. So I was just like I was videoing the whole thing and like
I didn't know that. I
oh
didn't.
my god, like I'll send it to you. Like I
I've seen clips. I mean, photos.
no, yeah, I have it. I have the whole thing
Totally.
on YouTube. Yeah.
Oh,
And then the other times I was in, there's the second time I went in, I tried to do the same thing, or the third time. I don't know. There was another time I tried to do the same thing, but I was just like, I think I was just kind of like losing it at that point, so nothing got posted. But yeah, the first time, it's all on YouTube.
did you do that out of boredom?
Oh yes.
Nothing
I
else to
started,
do. Yeah.
I no, I you know what? I started recording that actually. I wasn't even like I'd been triaged and I was waiting to go in because I was waiting for 3 hours. But like which didn't happen any of the other times I went in because I think after that I was in within minutes of walking into the ER. But the first time that was because that was my doctor phoned and was just like, yeah, you need to go to the ER, and I was just like, or my doctor's office, not my actual doctor. And I was like, can I go to class first? And she was like, okay. So I wasn't, I didn't feel bad at all, but I actually, I recorded some stuff of like, because you can't record people in the hospital, obviously. So I'd recorded some like ceiling in like the ER because it was fancy, and then I started like, and then I'd asked them for a mask to wear because I didn't want to get sick from gross people in the ER. So there's this like clip of me and I'm filming myself in the ER bathroom with this like mask on and like I'm like making like I'm super sarcastic and I'm like making jokes and I'm like I feel fine like
Yeah, that's just your way of coping, I guess.
well yeah but like I mean because I've like even though I haven't been in hospitals a bunch I've done the patient thing my whole life, right? So it
Yeah,
was stuff like that doesn't really like hospitals and whatever don't freak me out, they don't really faze me. um but like I was just like this is so ridiculous that I've like because the whole scene was that I'd been unable to move for weeks. I had like no hemoglobin, and then finally they're like, hey, you need to go to the ER and get some new blood, and I was just like, well, could have told me that a week ago. Like, it's funny actually, because Steve did tell me that a week before the actual doctor did.
Yeah, and you knew
Um,
something was right.
but like, yeah, so I no, because I went to class and actually my mom went home to get my stuff for me, and then I told her I was like, yeah, I was just like, if I look on the table and see if my video camera's there, because I wasn't sure if it was in my bag or if it was at home, and it turned out it was in my backpack anyway. But like, I actually purposely asked her to look for my camera so I could record crap. Like, who does that?
A lot of people probably do that.
Yeah, I'm like, I don't know. I guess it's just like kind of encapsulates my whole my the whole weirdness of that situation because I was feeling like at that point totally fine. I'm obviously not totally fine, but mostly fine.
God. No repeat.
But no repeats on that one. Yeah, but I mean like that's and I don't know maybe like maybe you don't find it as weird because you've done kind of like similar stuff, right? Whereas people who aren't sick ever would be like, why would you do that? Why like
Oh yeah. Well, I do it because well, my asthma is a little different than bleeding to death. I
yeah.
mean, it's physically too difficult to do it when you're, because I've thought about it before, like, because I'm morbidly curious, to to like try to video myself through the really bad times, and it's too difficult for me to do because it's as long as I've had the disease and as used to it as I am, well, you know how it is. When you have a really bad, when you're suffocating, the last thing you can think of is you can't think of anything else except trying to breathe.
Yeah.
Every time I think, oh, this time maybe I'm gonna get some shots I was never able to get before, it never works out for me. In fact,
Yeah.
all the shots I've had in like of me on the ventilator and stuff have been taken by other people because I just can't do it.
Yeah.
Uh,
Well, I mean, and I think that's, it's the difference between being like sick and being really sick, right? Because that's why, I'd intended to film stuff like other times that I was in the ER and I got nothing filmed. And
yeah.
that's, because I was, I guess,
Sorry, I forgot to put the telephone in the other room. It'll ring two more times.
um,
Oh,
it's okay if my phone rings, it's right behind me. Um, yeah, like if, you know, because once, like the first time I went in there and I felt fine, even though my hemoglobin was total, like the worst it's ever been. But then the other times I went in, I was like, I was feeling a lot worse and also like obviously very pissed off by that point. So I wasn't like, wanting to put in the effort to film stuff or I wasn't able to put in the effort to film stuff. Um, because, I totally would have done it, but it's just like, your head has to be in the right place to be like, oh, this is,
yeah, for
interesting.
for me, it's usually with the drugs that like when I'm sedated enough. Excuse me, when I'm getting enough opiates or like mega doses of steroids, it makes your brain. I mean, you're still sick, but you're breathing okay enough to talk, and but it's usually the drugs that make me want to do crazy stuff like that because I'm basically insane. I mean,
Yeah,
well, when you're, especially if I'm in the ICU and I'm talking or trying to take pictures, which I did last time actually. No, a couple hospitalizations ago, I managed to keep my camera in. And when I look at the video now, I'm thinking, oh my God, you were out of your mind. You just like totally messed up on drugs. This
yeah,
is, I thought, well, I don't want to give people the impression that this is how I normally am. You're definitely under the influence of just being in that environment where everything smells like antiseptic and you know what I mean?
yeah,
It's my way of escaping, but I can only do it when I'm able to breathe.
yeah,
I mean, you have to be really weird to like just set the camera up and like as you're intubated, as you're getting really sick and going down the tubes and
yeah,
like dying and everything to record that. That's a little too much for me. But
yeah, yeah. Like, it's I think that in general, like people, I guess in general you have to think in a certain kind of way to be, like, oh, I'm gonna capture this on film, like, and that just goes for anything, right?
yeah,
Because, I walk around with a video camera, like, even if I don't have it on, it's in my bag probably
Yeah.
80% of the time, right? Like, which is the joy of carrying a bag around is you can put all kinds of shit in there. And like, oh, we are no longer family friendly. I just swore for the first time on the entire
Oh,
thing. Um,
well.
yeah, like, you can put whatever, like, that's why I have 7 inhalers. No, 2 inhalers in my bag. Um, Actually, I no longer have multiple inhalers in my bag because that's the whole air travel situation is you got to put all your junk in the little Ziploc, so you got to make sure your bag is clean, or
You know,
else.
I don't know how long this meeting this was supposed to go on, but it's like I think 2.5 hours now we've been on it.
Are you serious?
I mean,
Okay.
I can't believe it's actually still broadcasting. We're still broadcasting.
Oh, it can go for 8 hours, my friend.
Oh, you're kidding. People do this for, I don't know.
Apparently. Well, you know what though? People like. See, I'm curious as to if anyone's gonna watch like this far because we've lost all of our viewers right now. We only had we at most we had 3 at one point actually, so that was more than I was anticipating to like tune in live. Um, but
It is.
like um, people do like 24-hour live streams. I don't know how.
I'm just talking.
uh, I'm not really sure. I've never had the desire to tune in for 24 hours of live TV or live internet TV.
No kidding.
Yeah, maybe next time we should structure ourselves a little bit better.
Okay, are you able to edit this or no? Because it's
Well, I
well, because
might be I might be able to do because it streams live, so people are watching or have been watching as it's been going. I can probably download it and then edit it, or I can just leave it as is.
that would be a major edit job. You'd have a lot of time on your hands. If
Yeah,
it,
I'm still working on the video from last week, so
oh really? Oh my gosh.
yeah, it's
Well,
well, you know what? Half the problem is that iMovie is being glitchy, and or else it would be mostly done, I think. But
I have 15 more minutes, so we can do.
all right,
Then I have to take a treatment. I should have just taken my treatment online since.
yeah, it's the asthma call.
Yeah, exactly. Show everyone how to do a proper treatment.
Yeah,
There's really
and
no way
then
to do wrong treatment. So
no, well, exactly. I mean, I guess unless you're like not, what you're not going to put the if you don't put the neb in your mouth, you're in a bit of trouble. Other than that, you're fine.
yeah, exactly. Even though I do have a mask, but I'm lazy. I don't like my face getting really wet.
Ugh. Yeah, I've never used a mask. I don't feel like I would enjoy this option.
When do you go back to school next week?
I'm done.
Oh, you're done.
I'm
Like
done.
you're or done forever.
Done forever.
So you graduated, or you're going to graduate.
Yeah, graduate June 11th.
So you're how do they say it? You're going to I forget how they put it in those letters when they send the cards out. Because did you get one from Liz? Because when I graduated, it was from an online school, so we didn't get any of that.
Okay. I got well. I have all I have right now is my thing that I have to fill out for like my cap and gown by May 12th.
So you might have to start thinking about a job, huh?
Yeah, maybe. Can't I just do this for my whole life and just like have conversations on the internet and
Get
you
a
know?
job like Mike, your friend Mike, the Mike.
Yeah. You
Doesn't
know,
he? That what he does for a living?
yeah, he does some stuff like that because they're always doing like the live broadcasts from Two Diabetes and um yeah, I mean no jobs like that exist in the asthma world, so I'll have to make my own job and find a way to get paid for it.
There's the mothers of asthmatics. They have paid staff. I noticed because they have.
But I'm not a mother of an asthmatic. I am an
I
asthmatic.
don't even know why they call it that because it's misleading. They should really change their name. They're
Yeah,
the closest thing we have to advocacy group. So
it's a hard word to say. No, you know what? I talked to someone. I can't remember if I told you this. There's a group in where are they? Arizona, I think. They're called Asthma Athletics, and they run like asthma sport programs for kids, and then
yeah,
they do concurrent asthma education sessions for parents while the kids are doing like their little like sport meetup thing or whatever. But I talked to their like head person a couple weeks ago, and I mean, they're kind of, despite being in existence for 6 years, they're kind of just trying to get off the ground and stuff. And so, I mean, really cool to do some stuff with them remotely. I don't think I want to go to Arizona, but
Oh, Arizona's cool. I wouldn't mind going there. Not to live there, but I wouldn't.
well, see, that's what I mean. Like, I would totally go there. I would go anywhere, you know that. But I don't know if I want to move to Arizona. I kind of like being Canadian. Um,
Oh yeah, yeah. I don't blame you.
but I do enjoy my proximity to your country because
Mhm.
I'm very close to, the border, which is beautiful.
Yeah,
So I
yeah.
can go get all the junk food I want.
But this guy
Um,
doesn't sell it.
yeah, well, no, like we don't sell the same good junk that you guys have. There
Yeah.
are no Abbas Abbas in this country.
That's which is really weird. Oh, Abba's Abba is made by Annabelle. You know that company? They make Big Hunk and
Yeah,
some
they
look.
make all the things that I can't bite through. Is that the story?
Those are made in Hayward. That's not very
Yeah.
far from here. I think 40 miles from here.
Yeah, because I was gonna say like those are like straight out of California.
Yeah,
I can't remember if I told you this, but WestJet's like all of their cookies on like all of their flights, I think, are made in San Francisco.
their cookies are some generic cookie factory or something.
They're like the Biscoff, is that what they're called? They're like I don't know, they're like little packaged cookies, but I saw like a stand from them on Fisherman's Wharf.
Oh no,
Um, but then I read the cookie package on the way back, and I was like, oh my god, all the cookies are made in San Francisco. And then I wanted and so then on my second flight of the day, because I flew from San Francisco to Vancouver and then Vancouver to Winnipeg. So on the second flight, I wasn't sure if I was going to get the same cookies because I was like, but I'm in Canada now. Am I going to get the American cookies? So I had to get them just to find out if I was going to. I don't even know if I ate them, but I had to get them to find out if I was going to get the same cookies that I'd gotten on the international flights.
oh yeah, because they
And
don't give you anything to eat anyway.
well, they give you your choice of cookies or like sesame snack mix or something. And
Oh,
I was just like,
you get a little something then, huh?
yeah, not
Oh
on American though. You get nothing on American Airlines.
yeah, I don't care for that.
Oh, that was like I don't know. I did not enjoy my American Airlines experience.
Oh, yeah, my poor cat. Oh,
Oh,
I totally forgot you were in here. Oh. So I didn't know if he has to go to pee on my floor. So, he was in there and he never makes a peep. I can never tell.
oh.
He's been hovering by that door for a while, but this is okay. I don't know.
Yeah.
Anyway,
So my cookies though came from San Francisco, so that was exciting.
San Francisco. Oh, I didn't even know they make cookies in San Francisco. I don't. This is a
Yeah.
factory there somewhere.
Yeah. I don't know. So that was interesting. American Airlines, no cookies, no. I I think they gave us a drink. Maybe not. Um. Yeah. I don't know. There was Wi-Fi on that flight though, so
Oh, there was. Did you have to pay for it?
you know what? I paid $2 for
Oh,
30 minutes of Wi-Fi just to say that I did.
not bad, not bad.
No, well, I mean the flight's like less than an hour, so by the time you're up in the air, and well, how long is the flight from LA to San Francisco?
Hour.
Yeah,
Little.
so by the time you're in the air, you get the Wi-Fi thing activated. You do your half an hour, then you have like 10 minutes left of actual flight before you start descending.
Yeah, exactly.
So it was, it was worth my $2, I think. I enjoyed my 30 minutes of internet in the air.
I think Virgin has that too. Um, yeah. Well, I
I
guess most
to-
do
I totally want to fly Virgin.
that.
Like it looks so cool.
For the purple lights and for the safety video is the only thing that I like.
What are the safety videos like?
It's a very non-safety video. It's hilarious. It's a comedy basically skit that they do. It's
Nice.
on video, but yeah, it's because no one ever pays attention to the video
No.
or anything. So that's pretty clever how they.
Well, you know what? I vaguely pay attention. I never take the thing out of the seat pocket anymore. But I sit there during the whole French part, because when you're on the Canadian flights, you got to listen to it in French and English. So I listen to the French part and I see how many words I can figure out based on the context.
Oh yeah,
Um,
yeah.
like, please put on your own mask before assisting others.
Yeah. And then, did you say you sat in the exit seats?
No,
Oh, you didn't. Okay.
no. I had one seat that didn't have a window, and I was very mad about that.
Because you have to pay more for those seats.
The
Usually,
exit row?
yeah, for the emergency exit seats, for
Yeah.
the exit rows, yeah, they usually charge more unless you just lucked out and got it for some reason.
Well, yeah, I mean, WestJet, they, like, unless you're booking, if you book your seats when you purchase your ticket, you get charged more. If you select them 24 hours before your flight,
Yeah.
it doesn't cost any more. So you could select exit row 24 hours before your flight and not pay anything.
Okay.
But I don't want to be responsible in case of an emergency.
Oh well.
But you get to board that first, so I mean that's
You did that?
you get to board first because they have to
Uh,
instruct you.
did you get were you allowed to skip security? Did you get on the friendly list or whatever this time, or where you don't have to? I mean, the airlines grant you like a fast pass, so you don't have to go through the
Oh no.
line deal.
You
No.
know, I was really not impressed with the layout of LAX for
Oh,
obvious reasons. Did
yeah.
my camera disappear again, or?
No.
Oh,
No.
okay. It just disappeared on my end, apparently. Um, yeah, because when you fly, well, like when I flew from Edmonton to LA, and then I had to go outside to get to the friggin' domestic terminal, and then I had to go through
No.
security again. I was just like, why? Why are you inspecting my liquids, gels, and aerosols for like a third time today? This is not okay. Um, yeah, so fortunately I keep my bag very organized so I can deal with that quickly. But like it didn't make sense to me. And then in Vancouver, it's like pretty much the same situation. I think unless you're flying Air Canada, I think Air Canada has something special, but
Mm.
you have to go through like you have to go out into the main concourse and then go to your connecting flight. So I had to go through twice that day too. Like
Right. I guess they got to keep everyone corralled up who's coming across the border until you get to your final.
yeah, but
Uh,
well, I mean, but they're not doing that, right? Because
uh,
you go through clearance, like back into Canada, and then you still have to leave the secure area to get on your next flight. So you have to go through security again.
oh, I see. Because you're transferring to a local, uh,
Yeah,
in-country flight. That's why.
yeah, but like when we went to because we pre-cleared U.S. Customs in Edmonton, so we went through security there, and then maybe we didn't. I can't. No, I don't know. I can't remember. Yeah, so we pre-cleared U.S. Customs in Edmonton, so you would think that once we've got to L.A., they've already been like, yeah, you've been granted access to our country. You can get to your flight from inside the terminal and not have to go through again. But no, no.
Joys of traveling,
Yeah.
airlines and all that.
See, and you know what? Like and I'm sure you have the exact same thing. Is that like I would not care at all going through security, but like, you know, if you're a person who just takes a bunch of pills, you gotta do nothing. Like we have to pull out all the stupid like medications because it's all like
Oh,
aerosol and whatever, and like put it through the scanning thing, and like you
yeah.
know, um, because and see that's the thing too is I would love to travel without having like stupid inhalers because you know how much there'd be nothing in my bag. I'd have like a laptop and an iPad and some snacks,
Uh,
and that's
well,
it.
yeah, I know what you mean. Yeah, I just kind of, especially when the line's crowded and you have to like, you need three trays.
Yes,
Right.
yes, that
Yeah,
is my life.
yeah, I know. It's better to do that than have to be rescreened and
Oh yeah. Well, see, and that's why I'm like so like I have my system down and like if anyone tries to like, 'cause, I was flying with my mom for the first time in years, right? And like, and she's trying to like, hold something or whatever. I was like, don't touch anything. You're gonna mess up my system. Because like, I can just the way I organize my bag and I make sure I can pull everything out fast. And so if anything gets touched, not good.
Well, I better get going.
Yeah.
Let's just say that I left the group chat. Who knows?
You what?
It says Steven has left the group chat.
Oh, that might just be like text because I think we're still streaming.
Oh, okay, maybe. Where's
And
my...
we're talking about nothing that's probably of interest to anyone right now, but
Oops, I forget that we're still live, I guess.
I know. We should have like went off the
Well, it's
broadcast.
been 3 hours. I don't know what the hell you're going to do with all this, but...
Well, it's just gonna go on YouTube and sit there. Like I don't have to do anything to it now.
Oh, good. Okay.
Yeah, yeah. I think we've been talking about doing. I know Dia and I've been talking about doing some podcast stuff, which would be more structured, but kind of like this. If
Yeah.
um, so that would be fun, I think. And I guess stay tuned for that if you're still watching after 2.5 hours.
Oh,
And it will be shorter. I promise. I promise it'll be shorter.
yeah.
And yeah,
Good.
because we didn't really discuss a lot of things that could be discussed. I know Dia had some interest in talking about of what was it, like some kind of like research and
Oh, yeah.
personalized medicine and stuff, and which is something I think is really cool to discuss. And hopefully we'll get that launched.
For sure.
All right. So I'm
Okay.
going to
Thanks,
stop
sir.
the broadcast. Thanks for putting up with us for this long. And hopefully we'll see you soon.
Hopefully.